How are you?
Good, how are you?
Sorry, I'm just rolling it.
That's
Good
okay.
morning.
I was like, Denise better show up. She's part of my intro.
Get my brain. Yeah. We'll give you a few minutes here. Yeah. Hey. Yeah. Turn out.
I know. I was just mentioning
And this is from ICFC. Yeah.
All right, we'll get started here. Everyone's time. Did everyone get coffee, water? It's all out there.
Oh, you mean government?
Can everyone hear me in the back, okay? Can you guys hear? Good? Everyone's good? First off, I guess my apologies. I'm coming off the tail end of a cold, so if you get a nasally voice today, I apologize. But I'm feeling much better. I'm looking forward to getting my steps in before noon in this room, because we have one microphone and all of you are gonna get a chance to use it. So, again, welcome. Today is kind of the kickoff to the governor's conference, so it's good to see everybody here. But we are kind of in a different environment today. So we wanted to first off invite you, excuse me, to share your thoughts today, but also just before we get started to really focus in on possibilities for resolution, possibilities for mitigating some of these issues. So again, we're not focusing on the concerns that we have, we're focusing on solutions. So keep that in mind. All right, so I am Shay Trafton. I work for Mountain Pacific here in Helena. It's our main office, but we do offer services in, well, it's now kind of transitioned, but our main states that we used to work in were Wyoming, Alaska, Hawaii, Montana, which one am I missing? Guam. Anyway, territories. Yeah, territories. So anyway, with that, the quality improvement organization's been restructured, so now we have a larger service area, but we're still a very strong presence here in Montana and across, I guess, the mountains and the Pacific areas. So with that, we actually do contracts with other entities. We are a quality improvement organization, but we also bid on contracts to help facilitate conversations across the state and across other contract entities as well. So we've got the opportunity to work with EPHHS on navigating how are we going to improve Montana's long-term care challenges. Again, we all know this is something that we really need to hone in on. So we are really excited to be here today to get your guys' opinions on how to fix this. So with that, I'll just move forward. I'm sorry, I'm jumping around. I'm so excited to get going here. This is the biggest turnout we've had in the summit, so it's so great to see everybody here. Housekeeping, I kind of went over it briefly, water, coffee in the hallway. There will be snacks. I put out a few things back there. I know it's not Halloween yet, but there's some candy. Adult trick or treating basically is in the back over there. So, but there will be snacks and stuff throughout. Lunch will be on your own. But again, bathrooms are in the hallway back there. So, and we realize that you guys have lives outside of this room. So if you need to step out or do work or whatever you need to do, please feel free to do so. I won't take it personally. I'll just call on you right when you walk through these doors. So anyway, like I said, my name is Shay Trafton. My counterpart up here is Marcy Gallagher from Mountain Pacific, but we wanted to kind of know who's in the room. So with this, I know that was kind of tricky, but if you can get your cell phones out and you scan that QR code, we'll be able to see your name and your role. Again, this is kind of technology at its finest, right? We're trying to gather all this information. So today, your cell phone will be approved to be used in this platform. And while we're doing that, I just like to point out to our specialty owl up here, if you guys have not used one of these, it's again capturing the whole entire room. So if you sneeze, it's gonna hone in on you. If you I guess take a bite too loudly, it's gonna hone in on you. So just keep that in mind. But it's a great way to capture everybody who's in the room because we do have people online. Sorry, yeah, I know it's small. This is just a ploy to get you guys to move up closer. I don't know how to make that bigger on the screen there. I was talking to Marcy today and I was like, gosh, I'm just really thankful to be here today because I was drafting my resignation letter because I was really certain I was gonna win that $1.8 billion in Powerball.
Glad you're here.
But unfortunately, you guys. So while we're doing this, just so you guys are aware, you'll see the live result up here. This is the first time you'll see your name. The rest of it, it'll be anonymous. So please know that if you have spelling errors or grammatical things that, I guess maybe you're embarrassed about, please don't feel bad because your name isn't attached to it. Right, they're coming in hot here. This is great. And then with this Slido, just so you guys are aware, this will be active. You can log in if you see the slido.com and write down that number. This whole presentation will be active for about 4 or 5 days after this conference. So you guys can, if you think of anything or want to add to it, you can always hop in and add more comments, just so you guys are aware. All right, we'll move forward even though you can still add to it. All right. So as we look forward to getting key players in the room to try to navigate some of these barriers and to offer solutions, these are some of the entities that we wanted to outreach. Now, this is our last summit. So unfortunately, if we can't say we'll invite them for the next one. But again, we just wanted to list a few that we've identified as key players. But I'm going to ask you guys to maybe add a few additional that in the event that we get going and we need to outreach, can you give us some more? Give us some ideas as to who maybe we were missing in this room. I gotta move that. How to get rid of that? I like a little. I'm not gonna touch it, don't worry. If I do. Great. Perfect. Well, again, as we get going, please do not stop and entering information. You will, you'll be able to enter as we continue forward here. All right, so we kind of, my apologies, this agenda didn't get updated, but it is kind of a fluid agenda today. For those of you who are very structured, maybe this is not for you. So we're gonna start today. We're gonna go through a background. We'll work through some of these objectives, but the conclusion will be around 4:30 today unless there is more information. We have no qualms about staying late, even to coordinate and to network. We really look forward to hearing from you today. But again, I just want to touch base. It's very fluid. Will I check in around noon today and see where we're at and see if we need to take lunch then or if we want to push it back because we do have a later start time. Okay, so this is my favorite part where I get to hand the microphone off to Denise and let her kind of give an introduction into this contract work. As I see some of you here attended the roundtables, but some of you have not. So I'm gonna let Denise introduce herself and go ahead and give a background.
Good morning. Can you hear me okay? Yes. Okay. Good morning. My name is Denise Brunette. I work for the Department of Public Health and Human Services. I work in Senior Long-Term Care Division, and I am the Bureau Chief for the Community Services Bureau. So what that means to you is that I work in state government, and I manage several Medicaid programs that involve long-term care. Those programs in the Bureau are home health, hospice, community first choice services, Big Sky waiver. There's multiple waiver programs in Montana. The waiver in our Bureau is aged and or physically disabled. And we also have the nursing facility program. I don't leave any out. We have 2 grant programs. I'm going to mention Money Follows a Person first. Its priority is about deinstitutionalization and people returning to the community and the choice of the living environment they choose. That program has been rebooted and is very successful. We've had great success stories. We've got some team members here I'm going to introduce in a little bit. And then we have the civil monetary penalty grant. And that's just breaking it down really essentially is nursing facilities are assessed penalties. Those monies are pooled by the federal government. And we have an opportunity to issue some of those out in grants to nursing facilities. Any questions on that? Very high level view. Excellent. So my team is throughout the state of Montana. We cover the entire state through the communities, not just all from Helena office. The Helena office just has a handful of us. And the central office is located on Prospect. It's right by Walmart. We just moved there in January. And then we have team members again throughout the state. The Big Sky Waiver Program contracts through two case management services to be on-the-ground services for the Big Sky Waiver population. And they are benefits and partners in home care. And they employ about 60 case managers that are on the ground to do the in-person and care coordination services for that population. And if I can the staff that are employed by the Community Services Bureau, please stand up.
Looking at that.
Yep. Looking around. Please stand up if you work in the Community Services Bureau. I'll walk towards you and make it really awkward. Rosa, I don't see you standing over there. Thank you. Okay, super. So this is Haley Horn. She works for Money Follows a Person. And then April Stottinger is here from Billings. She's the Money Follows a Person Director. Alexis Bartholler, she is in the Big Sky Waiver Program based out of Anaconda. And then Rosa, is it Alans? No, Alans. Thank you, correct me always. She works for Big Sky Waiver and she's based out of Billings. And she is also our staff person to a new service called Pediatric Complex Care Assistant. That's something from two legislative sessions ago that we are implementing to allow for in-home skilled care for kiddos with medically complex situations. Thanks, guys. It's, oh, Karina. Okay, who works in Senior Long-Term Care Division? Yes. Please stand up. This is Karina Van Dyke. This is one of our fiscal people, highly needed, kind of like a handler to me some days to redirect me and keep me on course. Thank you so much. Any of the Senior Long-Term Care Division employees? How about Department of Public Health and Human Service employees? Excellent. Hello, good folks. I think I'm just gonna bring you the mic so you can say your names and say your jobs. So I don't look like Kyla first.
Good morning. I'm Kyla Rock with the BOLD grant, our Alzheimer's and Dementia program. So it stands for Building Our Largest Dementia Infrastructure. We're with Public Health and Safety Division.
Hello, I'm Erin White. I'm a health educator, and I am with the Montana Arthritis Program and with the Montana Disability and Health Program.
Hi, I'm Melissa Dale, and I'm with these girls. I work with the Arthritis Program and the Falls Prevention Program.
Hello, I'm going to be an outlier here. I'm just going to say that right away. I'm Mary Anderson. I'm with the Wildfire Smoke Program, and came here really to learn more because our seniors are a very vulnerable population and how we can work better to serve them during the wildfire smoke event.
My name is Elizabeth Adams, and I'm here representing our section, the ICP HAI section. And we go into all the healthcare facilities and perform ICARs and help with infection control programs.
Hello, my name is Kimberly Lamb. I am with the Office of Public Assistance Medicaid Programs. I'm a specialized Medicaid program manager overseeing our long-term care and medically needy teams.
Anybody else? Okay, that's exciting. As Jay said, this is our biggest turnout. This is just wildly exciting. So glad you're here. Our job at the State Department here is we're not putting on a training today. This is a listening session. And I'll walk you into how we landed here and where this idea came from. But if you feel a pause, if you're asking a direct question, it's because they have firm instructions to do a lot of listening. And that includes me. I want to hear what you have to say. I want your ideas. So some of you might remember about 2 years ago now, a survey went out. And that survey happened because my then administrator, Barb Smith, current administrator is Lindsay Carter. Barb Smith and I got in a car. We were invited to experience a couple of tours in long-term care facilities, which we embraced and was very excited about. I myself, I've worked in a nursing facility, I've worked in group home, I've worked in assisted living. So I have a little boots on the ground a while ago that helped form me into my social worker career. Barb and I went out and we also met with what I thought then what might be unlikely partners. People are like, I don't really know why they want my time, but I'm gonna give it to them. I'm a public servant. People ask for time, we're gonna give it. We're gonna listen. And Barb and I got to see several things, including one facility we walked in and they just started a COVID outbreak and we put on our stuff and we walked around. We got to see what it was like for the staff to go through that and the extra steps and the extra cares and how it impacted visitors. We visited some county staff. They wanted us to know what it was like to have a long-term care facility in their community that was struggling. And we visited other agencies about the impacts of a dozen closures of nursing facilities and how that impacted them. We got some connections to some emergency responders and the impacts of dementia for some family caregivers and community members. And of course, you can't go really anywhere in this big, beautiful state without hearing about the challenges of transportation or access to healthcare, or getting healthcare in the right place, in the right environment. We visited some of the areas on aging about what it looked like to do or to have embraced the philosophy of no wrong door and how that varied from community to community and the impacts on this, the staffing for that, and the funding for that, or the lack of funding for that, and the needs of the community. At the time, there was the Medicaid redetermination effort that was going on. Who could help with that and what did that look like? How do we get the information out there? It does an amazing dashboard that was on the department website that I think every call I had for months, I was sharing that dashboard, just saying, please know, there's these efforts to keep this live and they were just to see how the needle was moving and the mailings that were going out. I often would Teams, somebody that was calling me that wanted to understand it better, and I said, let's do this on Teams. And I'd share my screen and I'd show them the list of the mailings that went out. And I think at least 90% of them had no idea that many mailings went out to try to connect with people about the activity about Medicaid redeterminations. And always the takeaway in those conversations, what do you think that the biggest takeaway was from those conversations? Anybody spit something out? I'm priming, you're gonna be really busy today. We're listening, you're gonna do talking. The value of having a valid address on file. Right? Super hard to get a hold of people that you really need to be in touch with without a valid address. We talked a lot about challenges on this visit that Barb and I did. Challenges, wins, sharing of knowledge, what the state could do more for long-term care in Montana, what the no wrong door look like, partnerships, likely and unlikely ones. There was also a very significant effort on a provider rate study that was done by Guidehouse and the impacts of it. It did many things, but it balanced out rates for providers that were doing life services. There's a reboot with rates. It was a very big study. A lot of people participated in it, which has made it what it was. I heard it references the North Star. It was something we all could look at and all get information and all use it for moving forward and looking at rates in an objective manner. Barb and I consulted with the National Academy of State Health Policy, excuse me, I'm butchering that, NASP, National Academy of State Health Policy. And they heard about Barb and I idea of, well, how do we just do more listening sessions? How do we get closer to that? Because this 3-day tour, the big learn was we need to sit down and listen and hear these ideas and hear the best practices and what can be done. And they said that they would support us with a grant on advisory on how to circle in on this. And so that's where those surveys came from. And we launched these surveys and we didn't get a big response rate. And I asked my staff, call them, reach out, bug them. We need these responses. They're to be used for something. I personally am very committed to not sending you a survey and not using it. Right, we're all busy, and a lot to go on, a lot to do. And we were very careful to craft questions that we would utilize each piece of that to not waste any minutes. We did 3 series of outreaches to providers to try to get them to respond. And eventually we ran with what we had. And I don't know if any of you have seen those survey response reports. They're done. There's something that fed this. We're like, okay, we got more listening to do. Let's do these roundtables. And we did 7 roundtables throughout the state. Got more information, like, okay, how do we keep moving forward? How do we turn this into 5 and 10-year planning? How do we turn this into informing elected officials, ourselves, our communities, and guiding towards active legislation that helps Montana form long-term service and supports and guide us forward in a knowledgeable way. So then here we are with the 5th and last summit from that journey. And there will be a report that's based on the roundtables, the summits, the surveys, what we've learned, and recommendations. And that is part of, the next phase is the department's work, or if others want to carry it forward in regulation changing, law changing, funding, whatever that might look like. So again, yeah, we are here to listen. We want to hear about how we can better serve our members, better serve our communities, how people can age in place and the environment that they're choosing. What does that look like? So we got a special ear for ideas, wins, things you've heard from other states, all the things. So thank you very much for being here. This is an awesome turnout. I know we've got people online too, but she'll tell us how many. So if you ask a question, yes, we will be helpful, but we really are here to listen. Thank you so very much for your valuable time.
And just to touch base on that, we have 12 people online virtually right now. Sometimes they pop in and out, but just so you guys are aware, we will be tapping into them. So those that are online, feel free to raise your hand or ask a question. The microphone on the owl will project it so you guys can hear the question as well. Okay, so like Denise said, we did 7 roundtables across the state. With that was our opportunity to really listen into the challenges and barriers surrounding long-term care in Montana. And again, that's not just long-term care facilities, that's aging in place, that is DD individuals having to find placement. So just keep that in mind, that we've kind of already captured a lot of this challenges and barriers and things that are problematic across the state. And again, you listen to one roundtable in Glendive, it's completely different than the roundtable that we listen to in Bozeman. So just keep that in mind, that we try to capture all of that information to come up with these objectives. Because again, we're trying to narrow it down. So today, we have concluded with a few different objectives. So obviously, communication was a big one. I think that goes across the entire state, that goes across even like within your facility, right? Access. We're a frontier, rural state. Access is huge. And then it's the other F word that we don't really talk about, right? Funding. That was big. We identified that with this, the funding is really problematic as far as, the window time that these guys travel from one end of the state to the other without getting reimbursed. And a whole different, gamut of funding issues as well. So we get to touch base on all of these today. But again, with this, we have 3 main objectives, but we broke it down even further. So again, with these roundtables, we are able to develop the data, and then we want to know with this kind of a strategy. So here I gave the objective, which is communication. The goal is to develop targeted education campaigns to increase awareness, preparedness, and understanding of age-related issues, including end-of-life planning. Now with this, where this came from a little bit was, I think people are, I guess, unable to access resources. They don't know enough about end-of-life planning. Do they stick their head in the sand and say, I don't want to learn about it because aging is a taboo? We don't talk about aging. I'm not getting older. My parents won't get older either. So again, we try to capture all of these issues that were identified in our roundtables and come up with a goal. So we feel like this goal is going to help drive us forward with a strategic plan. But with that, we came up with a strategy. This is where you guys will come up with a strategy as well. To collaborate with healthcare providers, community leaders, tribal programs to ensure culturally sensitive and accessible education is available statewide. Again, we understand that, like Denise said, updated addresses, those are big. But what if you don't have an updated address on file? Where can you go to get this information? So we were thinking one main platform, right? So what if there was one main platform? Is there a slogan of some sort that we can use to develop a campaign of sorts to help drive these, I guess, knowledge-based outreaches and knowledge-based programs to allow these individuals to access information that they're not getting. So the second one, and again, we're gonna break these down. And again, I apologize, I probably should tell you how this platform is gonna work. So what we'll do, because we have such a big room and different people, so we'll identify what we're talking about, the communication objective. We will get together with your group or team or table or whoever by yourself, I don't care, and think about strategies to meet these goals, right? So that's how we'll break down. And again, I don't care if you work by yourself, that's totally fine. And so we'll get together as a group and then we'll come together as a collective, bigger group, and we'll go across some of these strategies that you guys came up with, okay? So, excuse me. The second communication goal is to establish a centralized, user-friendly website that serves as a hub for statewide aging and disability resources. How many of you guys go online to look for something? 99% of us. So again, we're looking for one single platform, right? We feel like that might be a solution to this. How do we access that? Who's gonna run it? I mean, these are all details that we need to really dive into. But it would be nice for all of us across the entities, so OPA and DPHHS and nursing home administrators, nursing home entities in general can go to this website and say, hey, here's a resource. It's right here. It's underneath, you know, aging in place. Or when I discharge you to home, then here are the resources available to you. Here's your nearest in-home care facility, or excuse me, in-home care agency that can help you out. Here's how you're gonna get your meds. So, and again, this is in a perfect world, right? This is how we're gonna look at this. We're looking for strategies to help us with communication. So, again, with this being said, we're gonna dive in. This is where you guys get to communicate amongst your tables with your peers, come up with a whole bunch of different strategies, pop them in here to the Slido. Again, no wrong answers, okay? Please come up with something that you feel would be very beneficial to you. And for those of you who don't want to use the Slido, I have paper back there. Please feel free to write it down and I will come and grab it at the end of the session so we can collect that. It's just easier for us sometimes to have a virtual platform. So with that, I'm going to give you guys about, I'll probably give you guys about 10 minutes to discuss amongst yourselves how to develop targeted educational campaigns to increase awareness, preparedness, and understanding. Anybody have any questions? Anybody want to tell a joke? Just kidding. Keep your ideas for funding for later, that's gonna be the fun one, right?
Do you wanna join us? You're welcome.
give you a few more minutes on this topic, and then we'll switch to the other one.
I am. Yep. Yep. Yes. Yep. Yeah. Yep. Oh yeah. 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 I think I recognize you guys. Or no. Okay, that's nice. Okay, yeah. So.
But yeah, I know your dad.
Yeah, we'll go for sure. I mean,
Yeah.
that's his real thing. Yeah. I'm always like, what are you doing?
Of course. Yeah.
Yeah.
Nice to see you.
Yeah, nice to see you too. Ooh, I like that. The wheel.
Yeah, so this is like your state. An example of the case fighting
Okay, well, actually keep this if someone calls.
Oh, great.
You're welcome. You're my big mouth. I know, right? Oh, yeah.
Okay, so let's switch it over to the other goal real quick, and then we'll collectively talk about goals. I like this, just to point out something briefly, but this is such a great point. It's like, can we build off of what we already have? So again, that's another great point to think about when you're going through some of these things. What do we have that we can currently use that maybe enhance or build off of? So again, go ahead and talk amongst yourselves. I just wanted to point that out.
Some other ones. I've tapped out. Yeah.
I'm very nervous.
Okay, does anybody have a really great idea they would like to share? You can volunteer or I can volunteer. Anybody want to talk about the communication, maybe a strategy they came up with? Well, I already know one person, so I'm gonna go.
I'm Tia Carr, I'm with the Council on Aging in Lewistown, Montana. Our table consists of myself, our executive director, and our ombudsman. And some of the things we talked about were being able to gather that and get that information out. As was said earlier, the needs in Helena are different than the needs in Glasgow and what that looks like. One of the things I kind of brought up is it being a little bit like a wheel. So, or a tire, I guess. So the tread is like your seniors, those who are in need and those who are in need. And then we discussed those spokes. And Bob talked about the spokes being things like Council on Aging's, being on the radio, social media, mailings. Sorry, my vision is getting such that I need up and behind. Local things like SHIP counselors, those state health insurance program people, ombudsmen who go into the senior centers and help out, public service announcements, and potentially somebody at a case manager level. And with that being someone who is a provider for a specific need, who can partner with the aged, and being able to communicate that in every area. Because communication, like we said in Helena, can be a little bit easier than trying to communicate with those in a smaller community.
All right, anybody else? Perfect. I love volunteers. gonna start throwing the mic, maybe you can catch it.
So we were talking about where the communication lies and talked about we already have the Montana 211. Either implementing and working with them or going ahead and creating something similar to that. Because a lot of the thing, same thing is knowing where these wheels exist. You know, a lot of us just, we're so isolated, we don't know where the wheels exist. And within those, within that website, going by region, going by like, if you go to Yellowstone County, here are the resources. And here's the information and this is what they do. On top of not only resources, maybe a smaller community that doesn't have the resources for, say, evidence-based education, fall prevention, health education, could we put that evidence-based information on the website so it's downloadable and that they can provide that information within the community. I know back before COVID, we got all these, I run the community and senior center in Billings, and we got all these TVs, and we were supposed to do all this evidence-based on it, and then COVID happened, and now we have TVs. Like we said, it's like getting somebody a TV without any TV stations. And so, you know, starting to build on that, because I think some of it is the resources smaller communities don't have. So why aren't we working within the bigger communities to help get that stuff out there? And so that's kind of some of the stuff we were looking at our table.
So, Kristen, Paige and I with AARP, this is actually for the first goal, which was end of life, was to reestablish the Palliative Care Interdisciplinary Advisory Council that was passed in 2017. Its sole purpose was to look at end of life care. It brought to, there was a great coalition that helped to pass that, but nothing really happened when it went to senior and long-term care. Probably because it was right before the pandemic, but really it was, the main purpose was to establish a website in senior and long-term care that had all of the standardized forms for end of life, you know, advanced directive, post, living will, all of those resources, and then resources for the public, but also for the providers. It also had a component for educating primary care, because what we found back then, and it's still today, people aren't, primary care isn't as comfortable talking about end of life. And so if we can get their comfort level up to learn more about it, get people connected to the right palliative care resources, that we could go a long way. This isn't like, this is evidence-based. Other states do this. And I think we should dust off that House Bill 285 and look what's in statute and actually implement it.
Hi, I'm Lisa Shepard, and I'm the CEO of Missoula Aging Services, and I am also representing the Montana Area Agency on Aging Association in this moment. And we actually put in a proposal in response to the state's RFI for the Rural Health Transformation Project. And those are the federal dollars that are coming out to support rural health, as sort of a partial makeup for all the Medicaid cuts, but anyway. We put in a proposal because we want to see our state, or as AAAs, to partner with this company called Better Age. So our national association, which is called US Aging, is actually partnering with them nationwide. And so what they do is they have some evidence-driven assessments, health and well-being assessments. And so they are making those available through their website and partnering with AAAs around the country to do that. And the way it works is that people can go in and they can enter in what their information about themselves, what they're interested in learning about, what their needs are, and then they get a personalized report from that. It gives them general information about resources and education and things, but it also tells them where their local resources are. And so that's also where the AAAs come in terms of partnering with Better Age. And then the proposal that we put in is that we would partner with Better Age. There's a lot of detail in this, so I'm trying to figure out how much to say here, but that we would partner with them so that when people get that personalized report, it sends them to the AAAs and the aging network so that they can connect with real people to help them to access resources in their area, and that the AAAs would also be collaborating and partnering with the health providers in their area, and including volunteers and training volunteers and trying to make this work really well in rural areas as well. And then on the back end, the real plus about it is that when people go in and they do these assessments, it collects the data, aggregated data, so not, identifying the person. And then we as a state give that aggregated data, and we can use it to understand what people are experiencing around aging and their needs and their experience of aging in our state, and use that to inform funding decisions, policy decisions, that sort of thing. And so I just want to throw that out because I think whatever platform the state creates, it would be the perfect place to link to that Better Age system and to link to us as AAAs and to get that data. And also to give people that really personalized experience, because we know a lot of times when you go and you get general information, you don't really know what to do with it. You don't know how it applies to you. That's the first problem. The second problem is even if you can see how it might apply to you, you don't really know how to take the next step. And we all know when we do this work, that's why people come to us, so that we can be the real people who help them do that. And this kind of addresses all of those issues. And so here, I'm gonna give you this. This is a proposal, so you can kind of put it into the, I don't know, is there an official record of this? Anyway.
Yeah. It's recorded and it'll be, just kidding. Thank you. Does anybody else have anything for communication? No communication on communication. So I guess the other thing that we like to address here too, yes, we want to tap into resources that are already in the works. And I think that's one thing that being so frontier in such a big state that sometimes we don't know what the left side of the state is doing or what the right side of the state is doing. So if we could have one centralized location with all those links on it, I think that'd be great. So everyone can access where they need to be. Anybody else have anything? How about anybody online? Does anybody want to come off mute? No takers? Just to bring up something that came up in the other summits, because I do like to bring forward maybe some thought-provoking information. We were having a conversation about communication and bringing forward a like a slogan, right? So we talk about aging being kind of this word we don't want to talk about, this aspect in life that we're not addressing. So we were thinking about coming up with a slogan, and I can't remember exactly what they came up with. Like, remember Denise, what they?
We were spinning off got milk.
Yeah, like,
Yeah.
got to say, or I can't remember. Anyway, so like a slogan to attach to the aging process, where you go and even the providers would obviously have to get involved in this. So when you go to your provider, you get all these pamphlets or education. It's mailed out to you, it's on the radio, because that's one thing that we talked about. Because not everybody has an updated address. Not everybody watches TV all the time, but you're in your combine, you're in your tractor, or in your vehicle, and they tune into the radio. So again, just providing some sort of these slogans, right, to tap into, to make it catchy and make it so it's not such a negative connotation when it comes to aging. So again, any type of cool slogan you guys want to put up there, please do. Well, it doesn't have to really pertain to the question itself, but if you have an idea, pop it in there. And a lot of it is to promote individuals to make decisions for themselves prior to getting to that age of you no longer have any decisions that you can make. decisions are made for you.
That's
You
aging.
look great, touched it, you know. Or just, we just really want to promote this idea of you get to choose how you age. Okay, we want to see how individuals want to age. They don't want to age in a retirement facility. Well, that's great. What can we do to help you be successful in your own home? So again, these are things that we need to really consider when we look at this. Dave, you could probably attest to the fact that when they come to you in your facilities, that some of them are like, well, we didn't plan for this. We don't know. We didn't know we had to, you know, put our stuff in a trust. We didn't know, you know, we're not going to be able to get paid or reimbursed for this. We have no idea. So we want to try to navigate that and think about how can we prevent this crisis point for when you are at that aging point. Anybody have any thoughts?
I know that, working with clients, a lot of people, we don't want to talk about end of life or aging. And I don't know what it is, but in the last month or so, we have had several clients that don't have any POAs, which is power of attorney. And so they find themselves in the hospital, ready maybe to go into long-term care. And there's nothing in play. So now we are to not having any family that wants to take responsibility for their aging parent. And so the hospitals are tied, the assisted livings are tied, the skilled nursing facilities are tied. So power of attorneys are so important because now these people are gonna be into conservatorships, you know, where the state's gonna have to step in. So this is a really, you know, I've been really trying to really push a power of attorney. Everybody in this room should have a power of attorney. At the very least, if you don't have a will, because we don't know what the future's gonna hold. We don't know if we walk out right now, something's gonna happen to us and then our families, you know, so. Yeah, and it's something that we really need to talk about.
The other thing that, I want to stress is remembering the age group of which we're working with. These people, a lot of these people are computer illiterate. And those ones that aren't computer illiterate, when you go online to try to find information on something, are absolutely completely overwhelmed by the amount of information that's out there. And then we live in a society where there's concerns about scams and the wrong information being put out there, and websites that look absolutely phenomenal and are just the wrong thing. You're working with an age group that's used to working with paper. Even in our job titles, things like that, I'll be honest with you, I prefer paper. You know, I can make copies of it, I can file it away. You know, if we get a huge brainstorm and the internet goes out, I still have a general idea of what's going on and which clients I have to work with. So now let's look at the group that's older than us. So if we're gonna put information out there, and this is going to be something that is accessible to the public, we really have to keep in mind the amount of information that we're giving them. You know, simple questions like, where do I go for insurance? Got insurance? And then just general information on where they can go. By the time these people come to us, they're very, very confused on what's available, what's not available, is this gonna work? Then you look at a situation where now we have a family in crisis because they didn't do any planning. And so now we're looking at an emotional charged situation. I'm a long-term care ombudsman. The questions that I get, you know, are just absolutely phenomenal. And then if you are in a rural area, I don't know Montana very well, I've only been here about a year. You know, if you are in a rural area, they want that answer right now. Like, who can I talk to about this? Because they're usually in a crisis situation. So then it's, you know, you better have good contacts, you better have networked. I need to be able to talk to somebody who has that information because that's their job. And they're in communication is power, education is power, but we have to remember to keep it simplistic. You know, we're working with a generation that does not want to answer that question with A, B, C, and D. You know, you want choice, but you don't want to overwhelm them with choice. And that's so important, because if we're gonna spend all of this funding and we're gonna spend all of this money to create something that people can't use, we're already defeated before we even start.
I just wanted to add one more thing with her, on her, keep it simple on that part. This phone conversation where they call a number and then they say, push 1 for this, push 2 for this. They can't understand that either.
So does anybody have a solution? What's the solution for that? Because again, we understand that there's all these human interaction. Yep.
Hi, I'm Kate. I am a home care general manager out of Missoula. And I, honestly, our table, I don't think we came to a general solution of communication, but that entails on what's already been talked about. We have been talking about the problem with communication for a long time and what the solution would be. And I was telling my table how our provider agencies have established what are called senior networking groups. And this is a group where we get together in our county. So if you live in a rural community and your entire networking group is assisted living facility administrators, provider agency administrators, we have had people from Caring Transitions come in and represent themselves. And I don't know if anybody in here knows what Caring Transition is, but they actually go in to people's homes and help them if the elderly move from their home to an assisted living facility, to long-term care, something that is completely overwhelming for our elderly population. They will go in and they will do this. We all get together once a month and we talk about how to reach out to our communities. And the one solution that we've come to is the human interaction. And so what we've done this month, we're actually putting on a community event in the Bitterroot Valley, because that is a very rural community for those of you who are familiar. And we are holding this on an assisted living facility location, and we're bringing in just providers, people from agencies who do in-home care, from people who do caring transition, assisted living facilities, nursing homes. Partners is going to be there. They're actually hosting the event. And we're just getting that human interaction out to the elderly and disabled community. Here are your options. You know, our Valley Council on Aging is going to be there. I can't advocate enough for them because they are the hub for any kind of resources that people in the Bitterroot Valley need. So that's one solution that we have to maintain the human interaction without making it incredibly overwhelming for that elderly population.
I have 1,000 more steps before I have to.
Good morning, everyone. My name is Becky Bird, and I am a member of the Governor's Council on Aging, and I absolutely, totally appreciate your comments and the comments related to how we communicate with aging adults in Montana. We have the wonderful power of younger generations who can whip through this social media and electronic communication without any trouble. It's really quite overwhelming for me, although I do try to learn, but I think one of the things we have to keep in mind is what everyone said. We need to figure out how to communicate with aging adults on their terms. Social media, electronic communication is quick and convenient, except for the people who can't access it or don't understand it. We need to be very intentional about how we're communicating with aging adults, very intentional. Communication is not a one-size-fits-all proposition. The other thing is, I think we need to also understand that the advocates, the family and friend advocates for aging adults may not be any more comfortable or skilled in social media. I think one of the things we do at the government level and in service provision, we talk of bureaucracies. Keeping it simple, communicating with people with regular language is really important because we do have a problem with document literacy and document overload. So if we are going to communicate effectively with aging adults and their caregivers, their families, and their friends, it has to be on their terms. We need to meet people where we're at and just not make an assumption that the word's getting out there, because it doesn't get out there for a significant portion of our population, and particularly for our aging adults. So I really appreciate these comments. We have to be intentional with our communication.
David Kretz, Chief Operating Officer for Benefit Senior Services. Number one, just to say those comments. First, history says what you have to communicate because you have to know your audience. And there's two different audiences that you'll be talking to. One is the patient, that person, and also the kid. My dad is 90, plays in 4 jazz bands, he's in Maple Sport. Cannot use a computer to save his soul. His best friend, extremely computer literate. Getting if you targeted someone that's turning 65, they have to make a decision, they have to do something with Medicare, start there, give it back, what that has, different ways to communicate. They can be online. Some people are very savvy, some people are not. A phone number, a place to go. So the person is saying, you can go to this banquet, go to this place, whatever the audience wants, they can get it from that one source. The other is going forward, you could do this big campaign, you can talk about this, and we send out the information you want, we can break the huge mail to everybody in Montana, and in 6 months we don't again. I get people because an event happened, not because they decided to come to a long-term care assisted living. No one wants to be, all right? That's kind of the worst job. No one wants to be where I'm at. They come because something happened in their life, and that's what happens. So top of mind is what has to happen. It has to be a list that never ends. So know your audience and keep the information to them, and have all types of media for them to be able to get to.
Not about you personally, just make sure they want to be there just to chit chat with you. Always, yeah. All right. Come on. Hello, look at this. I didn't even have to call on you. You volunteered.
I just wanted to respond to a couple of things, and I don't know if this has been mentioned before, but one of the things we were talking about was this exact same idea, and it seems to me like with everybody's comments, the communication strategy has to be multifaceted, because you are dealing with a variety of individuals with how to get information. One thing that stood out to me last year, I attended a forum in Hamilton, and they talked about, it was with the Alzheimer's Association, and one of the things they said is, they're like, we still read our local newspaper. And so I think that's one of the things also that's where we need to be very purposeful and intentional, like was already said, about getting that information into those places. We also talked about navigation services, which we know how beneficial that can be, and follow-up calls, making sure that's intentional after those visits. The other thing I wanted to comment on is regarding the end-of-life care paperwork and documents. We've got, with our grant, we have a steering committee, and we have a couple work groups right now. And one of the work groups is actually working on getting those together and creating a place for those to live that's accessible. And of course, then next comes that communication strategy. Where are they? How do you get that information out? That kind of thing. I think that was what to say.
All right, does anybody have anything else to add for communication? Oh, perfect. And then after we're done with communication, just so you guys know, we'll take a short break.
Okay, as I sit here and think a lot about, we're talking about how to communicate for the older generation in different ways. And I start thinking that maybe part of our communication should be more proactive. And let's start talking to our kids when they're 20.
and we've already started doing this with our 20-year-old daughter. The sooner you start preparing, the easier it's going to be, right? And if we're focusing all of our communication and education on the group that's already going through this, which is very important, but if we also include the younger generation in that communication, not only are they helping prepare themselves earlier, while you still have all of your faculties and before you're in a crisis situation, but they could potentially help you as the parent when you start to get to that point as well. So we've already started having those conversations with our 20-year-old about even just a POA, because of course she's an adult now. What happens if she has an accident or she becomes disabled? Which sometimes those are, you're thinking about disabilities and those kinds of things too. So I think starting the conversation younger is important, especially now because we are aging longer.
That's a good point. I think that's one thing we look at this for the strategic plan, is that not only do we want to address currently where, for individuals, but also how do we navigate it going forward? All right, so I'll let you guys take a quick break. We're gonna try to turn the heat up in here. Is everyone sleeping? Okay, good. So let's jumping jack. Or we can take turns running the mic around too. Let's plan to come back around 10:40. All right, well, we'll try to find our seats here and keep going. I feel like with conferences, if you're not shaking from overdose of caffeine or freezing at some point, you're not doing it right. I mentioned this during the break, but just to reiterate, if you guys have a parking ticket that needs to be validated, you can go ahead and do that up front. I was guilty of parking in a 2-hour parking spot, so I moved my car. Yeah, did you not get one of these?
Well, I haven't checked in yet, because I thought it was super.
I don't know. Yeah. I also like to put a little caveat on here, Mountain Pacific and TPHHS are not, on the hook for your parking ticket. So before we move on to access, as we, took a break, did anybody come up with any other communication topics that they would like to discuss? Perfect.
My name's Jen and I'm with My Glacier Village and we're up in Kalispell, in Platte Valley. And we were just talking at our table about a couple of things and one of them was like, there's this stigma like we've talked about aging. And I don't think that's always gonna be there. But for those people who do have the stigma around aging, you know, what if we did some more of our education and awareness at places like Parks and Rec or the community colleges where it doesn't have that, you know, I'm gonna go talk about aging, but more like a life strategies and planning and awareness and things that you might not know, so that we can start planning and we know what's ahead of us. But I think that's right, when we do talk about going to an aging workshop, there's a little bit of a number.
Yeah, no, I agree. We were talking in some of the other, summits that when you go to like renew your license, you have to fill out your post or something like that. We're just throwing out ideas, but, yeah, I think that's a big one is we need to identify not only the individuals that are aging right now, but then those that will be coming. All right, so that brings us to the next objective. As we talk about these things, we identify that, yes, they're all really interconnecting, right? We understand that you can't really have communication, conversations without an access topic, or you can't talk about access without funding. So we do recognize that. As we move forward, we understand that they're all kind of intertwined. But right now, we'd like to share our focus in on access. So right now, up here, we have the access objective. And in the goals, we've identified to strengthen the capacity of rural and frontier agencies to better meet the unique needs of their communities, which we kind of already talked about a little bit, but we really want to dive deep into this. The second goal up here is enable consumers to remain safely and independently in their homes and communities for as long as possible through a coordinated approach that integrates health, social, and environment supports. I think the social aspect is huge here. We talk about those that want to remain in their homes, but then they end up being isolated, right? And so they don't have that human interaction, and their quality of life is actually probably less than what it could be if they're in a group home. So we would like to look at that and what can we bring to them to allow that social interaction. And then the third access goal up here, bridge the digital divide by providing technology access, training and support to older adults, caregivers and service providers, especially in rural and frontier areas, which again, we talked about a little bit. We talked about the fact that we don't have a lot of individuals who right now are computer savvy. How are we going to meet them where they're at? How are we going to provide them education or provide them with a one-on-one with someone who is able to navigate that technology for them? So again, here are the three that we identified in our roundtables. And so we're gonna break it down kind of the same way. I'm gonna let you guys talk amongst yourselves again, just to share your insights and to try to find a strategy for solution. And I'm gonna continue to say, or I guess emphasize the conclusion for a solution. That's a tough one to say, but we really want to focus in on a solution to these issues. We know what these barriers are, we understand those, we've identified those, but we really need you guys to come up with a lot of great solution ideas that we can maybe implement going forward. Okay? So again, first one, strengthen the capacity of rural and frontier agencies to better meet the unique needs of their communities. That's the first goal we've identified for access. So with that, go ahead and chat amongst yourselves and try to find a solution for this. Okay, I'm gonna advance the Slido goals, but please continue to keep, adding in your comments, even if they don't fit for the goal. We go through and look at each one of these comments and how they, I guess, coordinate. Over, so the next goal is to enable consumers to remain safely and independently in their homes and communities for as long as possible through a coordinated approach to integrated health, social, environmental supports. No. Okay. Talk amongst yourselves. And then they're gone, and then the for 2 hours for the like. Yes.
I don't know. I don't know.
Just a quick temperature check, is everyone doing better? It's a little bit warmer in here. Good. On the verge of having I know. Right? Exactly. I think that's what it is. That's the winter. In the winter, you dress for summer, and the summer, you dress for All right, I'm gonna move it on to the next goal. So the next goal, bridge the digital divide by providing technology access, training, and support to older adults, caregivers, and service providers, especially in rural and frontier areas. So again, this is where I challenge you. I know that we identify that this is an issue, but how are we going to mitigate it? I'm willing to farm out my children because they know technology like the back of it. It goes to the highest bidder. Starting at $2.
But I think it's also our technology. Yeah, I think it's yeah.
All right, before we get started, I just kind of wanted to kind of wrap up the reason why I offer my kids as technology associates, let's call them. When my daughter was 4, I got a very large package delivered to my door. I'm not sure, I'm like, oh shoot, I was sleep plotting the other day, but apparently she learned how to utilize Amazon Prime on her Kindle. And this big, huge, frozen, like, scooter showed up at my door. And you guys, it was like $240 for the scooter. And I'm like, what is this? And she goes, oh, it came. Oh, no, go right back. So again, that's why I offer my children. They're very good technology savvy. Just watch your Amazon accounts. Okay, so going back to some of this access issue, does someone have a very wonderful strategy they want to share before I call you out? Anybody? Yes, thank you. I knew if I stared long enough, someone would raise their hand.
I think just, why don't we partner with the schools, invite seniors in for lunch maybe, and they can just ask their questions. We've tried to host some technology training, like come in, drop in, and we'll show you how to use your phone and stuff like that, but everyone, it's all different, I don't know Android, and she doesn't know, and then it's old, and the icons are different, but I think the kids kind of are a little bit more agile with all that. So I think the schools.
There you go.
IT guru.
Okay, perfect. I have to hold it over here because you'll hear my breathing. All right.
I thought I'd kind of over process, like kind of the beginning of it, like, where do we start, like the solutions? I think we need to start somewhere. How do you eat an elephant one bite at a time? I think we need to get the resources out there for the community. Yes, we want seniors to come on there, but we need to have resources so each community knows where it's at. A lot of us don't even know where these wheels exist. When I worked at Riverstone Health, when I worked in WIC, part of our job was to know the resources within the community. When I first worked there, we had to Google everything, and that took a lot of time. And it takes a lot of resources to find the accurate information. And so what Riverstone started doing was they provide us, they went in OneNote and provided us all the resources within the community so that you could go on there and I could like just query out, like I could type, Medicaid, and I would have the information and I'd be able to print it out. And so I think that's where you need to start with the information so that the communities know where to go. And to start with that. And then we can build off of how do we get the information. So again, the provider side for everyone in the communities. And with that said, we also were talking about having the bigger communities help provide that resources because like with the Allies in Aging, they go out to their, within Yellowstone County and provide that information to the smaller areas like Borden, Shepherd, and stuff like that. And I think that's where we need to be utilizing the different areas to be providing that information. And maybe it's enough to like, where do we start that senior with? Where do we, get them into that information? And then the last thing was, again, using, and that's where I say, our students, again, we said using Girl Scouts, Boy Scouts, Key Clubs, 4-H clubs. I also oversee nursing students, and they're now put health promotion at the front end of their education. And so they come in and they do a whole semester with me, and then they have to do a project. And maybe the projects are, let's teach seniors how to use technology and use it appropriately. Sometimes because, the highest growing population on Facebook are seniors. They're the ones on there utilizing it. And so maybe it's like we start, we have, information there, but then also having, seniors, or, the nursing students or different programs utilizing, get their hours in, and then show how to use those. So those are our ideas.
Great.
Thanks. I wanted to go back to one of the other questions about access. And so we all know that those of us who work in AAAs and in the aging network, how much difficulty people are having getting their Medicaid eligibility processed. And that a lot of times anybody who looks like they might be an older adult is getting sent to a AAA or one of our partners. And so one of the things that we've been talking about, because we have a lot of difficulty helping those folks, we don't have any special access for them, although they think we do, and a lot of times FDA sends them to us, and then we just have to turn around and call them. And so one of the things that we've been talking about in the network
is the possibility of DPHHS actually contracting with AAAs in the aging network to do Medicaid eligibility or portions of Medicaid eligibility. That actually happens in other states. Oregon is one of those examples because it's really just a capacity issue for us. We could absolutely do it if that were our jobs. And so just want to throw that out there as an option.
Of course, clear across the road.
So we started something because we're really rural and it's kind of local, but I don't know if it could be done on a larger scale. We started teaching seniors how to use computers at all the senior centers. And our biggest following on Facebook is our seniors. Since we've done this, we've got just tons of followers. And we make sure we just put like menus and things on there. So, but it is good. It keeps them coming. So when we have information. So then we decided to try something a little more technical, I guess. We got a grant for a bunch of Amazon Echoes. And so every month we have a class, people can come to the class and then they can borrow an Echo for 6 months. We help them set it up and everything. And we enable all the skills that help them and show them how to do it. So if it hears a fall, it can trigger a call kind of thing. But then we're able to announce to all of them when we have something like, hey, open enrollment's coming up, make sure you make your appointment, here's the phone number. And so then they get these notifications without having to do anything. And so we're just testing it now, so we'll see how it goes. But then through Town Pump, we also, Area 1 actually got a big grant for computer labs at our senior centers. So we're hoping to get more people to be not so intimidated by the computer and just figure out exactly like, instead of overwhelming them with information, you know, this is your website, just set it up. So there's just a few clicks for them. But we're excited about how this Amazon Echo thing is gonna go. And hopefully next year we'll know that.
Another opportunity too for long-term care is, you know, providing long-term care, the facilities with the information on maybe providing a computer and, you know, as part of their activity. You know, let's go in there, we're gonna have a desktop over here. Any of our residents wanna come in and use it, they can do that. Thinking outside of the box as far as this information is concerned, think about the number of, you know, senior citizens that still have to work. You know, they just cannot afford to retire, and it's difficult. So, you know, putting some kind of, maybe a brochure, things like that into a workforce office, if they're going there, or, you know, somebody that's been laid off, unemployment, you know, throwing that information out there. So if they find themselves in a jam and they're like, oh my God, you know, I'm 72 years old, I still have to work because I can't afford to retire. I don't know what I'm gonna do. I'm on unemployment, I just lost my job, there was my insurance. You know, just putting that information in maybe some obscure places that we normally wouldn't think that we could. Community outreach programs, and Girl Scouts, Boy Scouts is really good, but just providing that information, maybe giving our information, you know, and going in and speaking in local education, high school, going and talk to them. He said, you know, nursing, you know, our nursing students and things like that, just providing that information to pass along, going in and doing those community projects where, yeah, we're doing health fairs, but, you know, do the school systems have health fairs? What's going on there? And just reaching out, thinking outside of the box. Papering, you know, your area with, you know, education, just giving them as much as you possibly can. But if you think about the number of, you know, elderly people that still have to work, my mom's 72, she still has to have a part-time job. You know, and it could be a struggle with, hey, mom, have you heard about this program? Have you checked into this? Maybe look into that. And just making sure that the information that we are putting out there, we're using a stencil for that. Once again, it's simplistic, it's black and white, and, you know, it's a paper form, you can give it to them. For those that can use, you know, the internet and hanging up as a reminder, going, hey, I got this community project or things like that. Habitat for Humanity, there's all these other organizations out there that push their projects to help individuals. And now our individuals that have special needs, are you qualified for this? Don't feel, you're in a car wreck, this has happened, you just lost everything. What accessibility do you have for it?
So with this access, I'm gonna kind of switch gears with this. I want you guys to kind of think about how are we going to get those in rural areas access to care or access to information. I think that's something I know it's hard to think about because we have a lot of bigger cities, but how are we going to bridge that gap and get them information? Because that's really where we're struggling here. And then also whoever put the banks up there, great idea. I mean, good job, pat on the back. I'll get you a piece of candy. But also with that, I think it's because what do? They go to the grocery store and they go to the bank, right? So that's a great idea. Here.
So I, work hard home care out in Belgrade, and what we have been doing is we've been getting a lot of calls from our farmers and ranchers. And so we have been, partnering with farm implement and tractor supplies and talking to them. And I think what has been really beneficial, is my husband has Parkinson's at 36 years old, and he is also out in the farming community. And there's a lot of farmers out there who now are getting diagnosed with Parkinson's and cancers. And so he is just quietly out there going, hey, there's a program for this, there's help for that. And just talking to them and telling them it's okay. And he goes out and he's like, hey, I messed up. The sprinkler rolled over me, but my wife downloaded Life 360 on my app and it gave her this notification that something happened. So she called me and I told her I was stuck under the sprinkler and she could come help me. Instead of waiting for the next farmer to come find you, it could be hours later or someone driving by. You can also implement with the technology in the tractors for the GPS location as well. And so teaching these farm implement companies to be aware of that and that access, that they can get those programs locked into their new computer systems in their tractors to help those older men and women. And then I have also been presenting a lot about the accesses to care and how to live long, successful lives at home, going through Women Who Ag. So Montana Farm Bureau is huge on this stuff and getting presentations out there. So getting into different insurance agencies and like they said, banks and stuff like that. It's just taking an unconventional route because we are dealing with a huge issue in Montana that they don't want to be put into care. They don't want to be told, I have a caregiver. I just want a friend that comes and helps me. So just telling them that that's okay, I can be your friend, and then help on the backside and just educating that way.
Kind of that idea of a community health worker, right? I know that was something that was implemented, but now I think funding wise, it was no longer continued, but that was something that we came up with in our other summits is the idea of these community health workers that are out there. That is such a great idea about, we do have a huge ag population that would just, I live in central Montana, I never thought of that. And we have such a huge population there. Anybody else have access strategies? Perfect.
So I'm taking a class through University of Wisconsin-Madison, and so you get information from what people are doing all across the nation. And one of the things that they talked about in Georgia is they have taught beauty salon workers and barber shops to do blood pressure checks and give out information there. So we talked about in your communities, we're talking about how every community is different. Where are people going? If they're going to churches, if that's you know, that you're getting information there, or like beauty salons, or if everybody's going to coffee every morning on Saturday, having information available, like trying to make those partnerships.
Great idea. These are really good ideas, what I'm seeing up here, you know, to get that out there. I think we talked about the communication piece, you know, basically coming up with a slogan, but again, you put it out there as much as you possibly can. And then also, just a tidbit, I feel like we put a lot of emphasis on, I guess, for teenagers and for those growing up, we put a lot of education in that aspect, so why not? When we're looking at college applications, why not put in front of them this information? You know, unfortunately, that's, you know, we gotta tap into some of these and normalize it. All right, what other strategies do we have? And it doesn't have to be just associated with this one. I'm just gonna bring back to you guys the access to care. So we talk about AAAs, and they're great, and they are essentially a hub and a resource, but they run into issues too, right? So they run into, here's what you need, but there's no service in your area. So how are we gonna help with that? Anybody have magic wand for that one? Or an easy button? Oh, there you go, sorry. Just yell next time, yeah. I have those blinders on my board.
I'm Autumn, I work at Missoula Aging Services, but I worked in the Medicaid waiver program for a long time. My idea is to help nurture adult foster care. I've seen a lot of assisted livings close in this state, especially in the last 5 years. We have an assisted living in Missoula that just decided to not take waiver anymore. And there's not a lot of options for people who are looking for affordable care or for waiver care. And there's a lot of people who are caring for an aging parent or seniors that are living alone that could potentially share services. So I think we need to look at shared delivery models where people can either live together and share services, or they can sign up to be an adult foster care and get reimbursement to have a couple people living with them.
Anybody else have anything? I mean, we look at, I'm sure, you guys have a great lot going on as far as providing one-stop shop for all the.
Covered that in the 15 minutes. Benefits and use services we have now is 3 long-term care facilities. One assisted living facility. So 146 beds for long-term care, 71 beds for assisted living. Right now we're scraping ground for a 100 unit independent living, and healthy aging. 25% on reading. If you go by 10, you can see a bunch of construction. Hard to film it, is putting it up. But healthy aging, trying to keep our residents away from me and at home. And that should be over in 2 years. August 2026. Going back to the thing. So how to deliver to our seniors is to, I've never been a fan of I have everything for everybody. But I think with our seniors now, we need to be everything for everybody. We talked about how to get the information out there. I've heard people say, do it this way, do it this way, or do it this way. We get to do it all ways. And I provide service for them. My big idea is Echo, or Alexa, or something like that. We do have fall prevention. The person falls and calls somebody. And it monitors at home all the time. Where if the budget came out, every senior could get one. And then put them at the schools, so the schools could actually then go to seniors' homes and actually set it up for our seniors. And no one brought up Wheels on Wheels, I'm sorry, for being able to get information on. Because a lot of the needs that are out there that need help are mostly.
Additional 15 minutes, okay. Anybody have anything? Perfect. Do you want me to meet you halfway? Just kidding.
So a lot of this is about resources, right? And I think it's really important for us to start getting more politically savvy and getting to know your legislators and your city and county officials. I mean, many of you already do. I'm not trying to discredit the great work you're already doing, but being really strategic about who's on your boards of directors. The hospitals are masters at this. Many of the hospitals have legislators sitting on their boards of directors. I think we need to look at that. Anytime you have an event that's amazing that you're doing in your communities, making sure that they're invited. And we're gonna have more about this in a breakout tomorrow. But yeah, if we want more resources, we have to convince the people who allocate the resources that we're worth giving them to.
Yeah. I warned you.
One of the things that we've looked at in expanding care to rural communities is the idea of self-direction and having a paid family member or friend or someone down the street. But one of the barriers that people find is they don't know that someone 5 miles away provides care for someone that they care about. So how do we share those resources? So we've developed a provider directory, if you will, where caregivers, whether they work for us or not, can go in and build a profile and say, hey, I'm interested in helping more people in my community. This is my history. This is what I'm interested in. And then anyone can go in and search through those profiles. And it makes it a little bit more comfortable for people instead of going out or being an extrovert and trying to find people to provide care. They can, from the privacy of their home, go through profiles and find people with similar interests and share caregivers within a community so that more people can get help from a smaller workforce pool. Oh, sorry, I'm with Consumer Direct Care Network. And so we provide in-home caregiving, nursing, and personal emergency response systems, but they don't have to be affiliated with our program to use the system. It's live on our website. Anyone can create a profile. It does take 24 to 48 hours for it to go live because we vet it for appropriate content. But then anyone in or outside of our network can go on and look for caregivers or different resources and utilize them as they wish.
Well, and I think that's a huge thing, April, is that we don't know what's going on exactly. There's such great work going on out in Montana that we're just like, oh, we didn't realize that's happening. You know, and I think Kyla, you and I talked a little bit in the roundtable, is that there's so much going on. It's just, we're duplicating efforts right now. So let's try to get it together and streamline it. Yeah, so, sorry, when you guys have the mic, will you make sure you announce who you're with and your name so they can see who you are? And stand up and give one interesting fact about yourself. Anybody else have access? It's just such a big, broad topic, really, and I think we talked about it a little bit. Over here, we had a conversation. How many of you guys, when you hear about improving Montana's long-term care challenges, get overwhelmed? I do. And I'm supposed to be helping write a report for this, and I get going, I'm like, I don't even know where to start, I don't even know where to end, I don't even know where the middle is, because there's so many challenges out there that I just don't, I mean, it's hard to navigate. Does anybody online want to come off mute? That's the idea of joining virtually, so you don't have to talk, but if anybody wants to. Again, I think as we go through this and our objectives, there's a lot of conversations that have been happening around how to navigate this. And again, it's the reality that we live in, right? The baby boomers are leaving the workforce. And so now we're having an influx. And how are we going to care for these individuals? Because right now we're seeing closures. We are seeing that resources aren't available. We have now, once they leave the workforce, we have limited workforce itself. So now we have staffing issues more so than we do now. So how are we gonna provide care for these individuals?
So my name's Jen again, sorry to hog the mic, but, I encourage you, I don't know how it would work in really rural areas, but My Glacier Village is a local chapter of a national program, I talked about it, I think last year, called the Village to Village Network. It started in Boston, and I encourage you guys to look them up. It's vtvnetwork.org. And essentially what it is, we're kind of web-based, but it's built for seniors by seniors, and we have members and volunteers. Our members can put in a service request onto the website. It could be for a ride to an appointment, or hanging a bird feeder, or hanging pictures, or helping with weeding, whatever. It's all pretty basic. It's not in-home care. And then every day around 10:15, our volunteers get an email that says, here are all the open service requests. And so if you can do one, you click on a red button, and then you get an email about that member with their name and phone number and what they need, and maybe they're on oxygen. It's got some logistics in there. And then you give them a call and you arrange to pick them up or do whatever it is they need to do. And then we help with groceries. It's all, like I said, pretty basic, but we have about 100 members and volunteers, and now they've all become friends. And somebody over here said something like, they don't need caregivers, they just want a friend. And so now they're friends, taking each other places. And you talked about the retirees who are like, now what do I do? I'm 65, I'm going to be 100, and now I'm bored. So they also have a reason to get up and get out of the house and make new connections too. So look up the Village to Village Network. We're called My Glacier Village. And it's cool.
And another really great kept secret, no idea. I think we're talking at the Great Falls Summit, don't they have like, oh gosh, what is the transportation? Yes, go grandparents or something. Or something like that, right? Yeah, but I mean, there's so many great resources. I mean, even just collectively in this room that, again, I've been across the state and I haven't heard of it that yet, so.
So mine is there a place, this is a question, is there a place where we can all get together and start putting in these resources? Because where do we start? I mean, if we're duplicating services, and I'm hearing like 1,000 different things here today and where all these things are at, but we need to have one place where these services are so that we know each community can like submit it, and get that information out there, because then I think then that's where you start, like, where are the gaps? Where can we help? Where can we send people to? And I think just the fact that we don't know what we don't know, I think we have to have some way of getting all of our communities to start submitting the resources within our communities, so we know where we start with.
Kyla with Alzheimer's and Dementia Program, and I like long walks on the beach. And, but in response to that, we were starting to talk about that at our table, and I wonder if some sort of like a statewide learning collaborative might be beneficial to, because there's the ADRC website, there's 211, I feel like people have tried to do this a few different ways, and so how do we tighten that up and make it accurate and make it, so maybe there's some sort of statewide committee that folks here can commit to participating in, gathering all that information, making sure that all those sources that already exist, that the information is already out for, is updated and correct. And I don't know if that might be something that would be useful for folks. I would sure appreciate it, because I know that's something I'm trying to do with my work, is trying to figure out what is happening across the state specific to dementia needs, and there are a ton of things happening, but they are these little pockets in response to what their communities need, and so it's, yeah.
And I think you volunteered Heather to head up that. I think she's not busy enough. I feel like Heather needs to be part of it.
not without the committee.
Hi, my name is Marcy, and I'm the Area Director at Area 2 Agency on Aging. And just kind of a comment here, as it's frustrating to me that we're sitting here having to go through all of this. I've been with Area 2 for 22 years. I've seen how we used to network together a lot more. Now we're so siloed. That didn't just come from COVID and the pandemic. If you talk to, I represent many rural communities, 10 different rural counties and 2 tribal entities through our area agency. And what we have seen is many years ago, when the state made the decision to pull APS offices and OPA offices from our rural communities, that is when we lost our resources. And so that to me is the beginning of when all of this started. And I'm not blaming anybody, it's just a frustration. As I go around and I have to talk to the county commissioners in 11 different counties, and I hear the same message over and over again. And I'll take Carbon County, for instance. I sit on a task force there. We're trying to figure out this very thing. What do we do in Carbon County? And in Carbon County, it is they lost their nursing home. They lost their assisted living facility. They have community health care workers. They've got a wonderful public health program, attends or monthly visits all 6 of their senior centers. We have SHIP counselors there. We do a great job of communicating throughout that county. But when you sit and you talk to the county commissioners and they're trying to come up with their emergency services plans, they throw their hands in the air and they said, well, here we sit. So we have an emergency, no matter what it is. Is it a natural disaster like they had flooding a few years ago? Is it someone in crisis with mental health needs? We have 0 resources to handle this or take care of it. And so it is frustrating that as decisions have been made over the past several years, I feel like we've created the crisis. We've been absolutely a huge part of creating that crisis. And I know there's funding issues. I know that we have to conserve funds. There's different reasons that these offices have been pulled. But if you're sitting in Carbon County, and they're not the only, I'm not from Carbon County, they're just a major task force that I'm working with right now. If you're sitting in Carbon County, your APS worker comes in out of Billings. You talk with your APS workers, they're too darn busy in Yellowstone County. And so your little outlying counties that they serve are kind of on the back burner all the time. OPA offices, we would have to travel into Billings from any of our counties. So you might drive an hour, 2 hours to get there. There's lines. And you sit in line and you're gonna hope that maybe you make it to that door or that counter before they close or decide to quit taking clients for that day. And then you get to go home and you might try it again the next day. This is the reality of services in rural Montana. And so we sit here and we talk about how do we fix it? How do we fix it? I really feel the state has a responsibility. And I kind of feel like right now I'm hearing the AAAs be put on the back burner. We used to be a huge aging network where AAAs were a hub, we were a core. And we were looked to for these things because that's what we do. We know what's going on in our communities. We partner with those individuals in our communities, whether they are Winnett, Montana, with a population of the whole county of 300 individuals, or if we're in Yellowstone County, population, whatever they are, 100,000 plus. We refer to our local resources. But in our rural communities, we haven't made great efforts to get those back. So my whole thing is, I beg of the state, of the OPA office, help us, help you. That is what we're here to do as area agencies. We are skilled at it, we are trained at it, our partners are trained at it by the state. And so when Lisa sits here and says, contract with us, help us, let us help you to Medicaid eligibility. We sit here and we have lots of good ideas. We work with the extension agents all the time to reach our farmers and ranchers because our rural communities are farmers and ranchers. We do a great job of doing this, but people do not listen. They might listen, but until they are in crisis mode, they don't look at what those resources are that they need. How many people have worked in aging services and know all of this, but until they need it, and then when they need it, they panic. And that's why it's important to have us face to face. That's why it's important for all of us to be talking and at the table when we talk about networking together. I think you said that. It's hugely important, but we need the state to come in and back us in these other ways, not continually rebuild the wheel per se. If we work with the structure that is there, there is structure there. We need to guide. When we talk communication, you type in these things on Google, they might go to Consumer Direct. They might go to another entity. Nothing brings you to the state DPHHS website. We're not doing those driving forces online to get you to these necessary hubs where we can make those referrals, we can make those phone calls for you, we can assist you. But when we sit here and talk about this, this is all really great information, but we all need the help from the state, because that's what we're here to do, is help them as well. And that's just my comments on all of it. Thank you for listening.
So as a resolution, I'm hearing, again, cross-platform communication, networking, let's work together to mitigate some of these concerns. Anybody else has?
There was just a comment
Oh,
in
sorry,
chat
yes.
really quick. This is from Nina
Don't forget that.
Kensington Pat, social worker at Fort Harrison. And she said she used to live in Boulder, Montana. The grocery store there would allow for people to advertise services, caregiving, transportation events, and more. And it's helpful to make sure the information is legitimate for people not getting scammed.
Hi, I'm Mary Ann Kinter. I work for A Plus and Addis Home Care. Every month, we have 14% of our Medicaid clients that don't have Medicaid. And there's no place that they can go for help. So they can't just buzz down to the OPA office, because some of them they don't live where there is an OPA office. And they try to call on the phone, they don't get an answer back. I mean, some of them, yes, there's a spend down, and they go, we've paid the spend down. And they have the check, they have the check number, I should say, that they've sent to the Office of Public Assistance. But 14% of our Medicaid clients every month has trouble. And then by the 15th, it's dropped down to like 7% that they are able to have, those others are able to get Medicaid. Now, do we automatically put them on hold? We believe at A Plus that, I mean, it varies. If a client really needs the help, we won't put them on hold. We've lost money in that time frame because they need the help, and we're not gonna just leave somebody cold. You know, but yes, eventually we do have to discharge them if they don't have Medicaid within the 45 days. But if we could, I agree with her, that go back to where we have the OPA offices in the small towns that helps these people, because they can't just call on the phone, because that's not working. It used to be that we could refer them to the governor's helpline. And now the governor's helpline is saying, call Office of Public Assistance. Well, that's not working either.
You know what I think, as we talk about these issues, I think one thing to, just really keep in mind is that, everyone gets kind of a stigma, right, sometimes, but there's also challenges on the back end of that. I think when I think we talked about, OPA, when they closed all those offices, that they were asked to do more with less individuals. So they are feeling the heat as well. So again, with that, we talked about what would be the ideal, or what would be an opportunity to improve that, is that we have like a assigned caseworker. So with your last name such thing, you're gonna get Susie Peters every single time you call. So those are things. And then we talked about educating them on these resources. And not only do we have to educate the individuals, we have to educate the educators, right? So you have to know what services are out there in order to educate on that. So yes, I mean, I know that there's, issues, we talked about at the roundtables, but we're just trying to figure out how do we work together, like we talked about, how do you work together to make sure that we're running seamlessly? I see a waiter, I feel like that's a comment, no, I'm kidding. Careful, it's like an auction, you raise your hand too high, you're buying something. Anybody else? Do you guys have anything? It's kind of been a quiet table, but I think that you guys have something to offer. Yes, there you go.
My name is Jerry Bex. I sit on the advisory council board for the and I worked in healthcare for 14 and a half years at assisted living facility. And we run into a lot of troubles where we're at because we're in a very, very rural area. And there is some help for the natives around there through IHS, but for the non-natives, it's very hard. So I'm listening to some of the things about apps on phones and all that stuff. That's great, but when you live in a rural area, you're lucky if you have cell phone service. The ranchers, the farmers who don't have that accessibility for them to have cell service way out Otter Creek or up Broadus Way, some places. But and I understand when you call OPA, you don't get an answer. And it's hard when you're in a very rural area. But some people don't have transportation. And so maybe transportation would be something that, maybe the county could look at to provide in these small towns, getting with the commissioners or stuff like that. But yeah, we are faced, it's like we're in our own little bubble there in Ashland, Montana. 900 people that's surrounding 15 miles out, and so very small. We got 2 stores, 3 weed shops, and 2 bars, 5 churches, and so it's different there. But yeah, just listening to everybody talk, I understand, like the bigger cities where everybody is saying too, there's a lot of resources. We don't have hardly any. The nearest clinic, I guess, or whatever for a non-tribal member is 40 miles away. And for people in Ashland, the nearest clinic that are native is 20 miles away. And so you gotta be tough. You gotta grow up tough. But there has to be something that would fit for us also. I mean, how can we get that kind of help in a very rural area? And so I'm sitting here listening to everybody talk, but some of it's just out of our grasp a little bit. I don't know why, maybe it's because we're too rural, but to have a centralized spot, even closer to the bigger, and maybe have like an office there that could help certain things. I don't know, it's still 40 miles away, but well, there has to be something out there that, I don't know, if it's just staffing with some of these places. I mean, everybody runs into staffing issues. Because you talked about having a caseworker for the letter A, whatever. But you know how many people have a last name for the letter A in the state of Montana? But, it gets hard. And so if there's staffing issues and the training and all this other stuff that goes on, I understand the difficulty behind all that stuff, I really do. But I just listening to everybody, but I think that where we're at, we have our own little struggle. And it's hard, but just hearing certain things I guess perks a little ideas in my brain. Because I know there's some apps out there like Fall that'll help. There's GPS you where you're at, similar to the rancher, farmer stuff. But yeah, it's hard. It's hard where we're at. It's rambling now, but yeah. Want me to tell you a joke?
Yeah. We're gonna do karaoke at the end, so save that. So with that, I kind of wanted to call you guys. I'm sorry, I'm gonna call you out for. Okay, Fiona, do you want to talk about? So there is kind of a counter contract that is working with Mountain Pacific to kind of identify some difficulties and, more so in the Native American communities. And so I'm gonna give over to Fiona and just kind of give a brief overview and we'll go from there. So we are looking at all of these entities out there.
Thank you, Shay, and hi, everyone. My name is Fiona Grubin. I work with the Montana Office of Rural Health and Area Health Education Center. We're based in MSU, and yeah, we've got a contract from the Senior Long-Term Care Division to try to do what Shay has done by having listening sessions, but visiting all of the reservations and urban Indian organizations in the state to try to learn what's working well, what's not working, what are the needs, and what are the opportunities to improve senior and long-term care. And one thing I was thinking and hearing is really echoing what you shared, that, you know, investing in tribal healthcare infrastructure can serve those rural border towns and communities. You know, I think it's a big value to serve your whole community, whether people are native or not. So that seems like a huge opportunity. And even just, you know, there's a conception that IHS is supposed to provide healthcare for Native people and Indigenous folks. They have no line item in their budget for senior and long-term care. And 2022 was actually the first year that the IHS budget had any funding for addressing Alzheimer's and dementia. So there is definitely like a gap in services there.
That's perfect, yeah. I guess we just, again, my idea was to touch base up that we are looking at all across Montana. You know, so this is something that we're excited to see what other entities, I did not realize that. So the line items, interesting. And don't worry, guys, we'll get into funding because that's everyone's favorite topic here shortly. How are we doing? Before we move forward here, let's get a idea. We are at 11:51. Do we want to break for lunch at noon? Is that okay? Okay. And then I just need you guys to really wrap your mind around the fact that I need you engaged and super excited about funding when we come back from lunch. Because that's the tough, it's tough, it's really tough, and I'm gonna just preface that. But try to think when you guys go to lunch, let's talk about how are we gonna financially subsidize this, what other barriers, what can we tap into that's already out there, grants, all the fun stuff. If it was up to, again, my children, they would just use the card that doesn't run out of money, AKA my debit card. That's not gonna work, guys. So anyway, we'll address that when we come back. So I'll let you guys go a little early. And then we'll come back and start up one. Okay. Good. Again, I apologize, I was looking for buttons to push to get the air off, but that's how it is. So if we need to do laps around, that's fine. So this afternoon, we have one last objective to cover. And again, we've identified a lot of the issues that we've had. We've come up with objectives, strategies to mitigate those goals associated with the objectives. But again, our last one is the final one. Fiscal, financial, money, all the fun stuff. All right, so the last objective is to join the conversation on how we can address financial barriers, improve reimbursement models, and ensure long-term sustainability for providers and consumers alike. So again, let's put our thinking caps on here for objectives that we can use to push towards a common solution. So the first one we have is reduce the economic obstacles that prevent older adults, caregivers, and rural residents from accessing the care and services they need to thrive. Okay. The second one will be modernize reimbursement systems to better support aging services, care coordination, and rural provider sustainability while incentivizing quality and person-centered outcomes. I just want to just briefly hone in on that statement. I think as we go through this, we really need to focus in on the quality of care, right? The quality of life for the individuals we are serving. So just keep that in mind. And then build a stable, aging, and care infrastructure that is prepared for future demographic and economic shifts, supporting both those who deliver the services and those who rely on them. Okay, so those are our three main goals. And I know that we'll have some people trickling in here from lunch. Hopefully I didn't scare them off in the first half. So we'll go ahead and I'll give you guys some time to dive into this. So as we go through the first one, the goal is to reduce the economic obstacles that prevent older adults, caregivers, and rural residents from accessing the care and services they need to thrive. So go ahead and discuss that one at your table, and then I'll let you know when we're moving on to the other ones.
Really good. I mean, it's real. Yeah.
And then something just to maybe a little thought provoking, I put in here an asterisk. Think about a specific economical obstacle that maybe you or a loved one or a friend may have encountered and how you would suggest navigating that barrier. So again, we really want to personalize this and think about how to navigate some of these financial barriers. Obviously, my main strategy for solution with this one is that $1.8 billion that I was supposed to win last week. Okay, it didn't happen.
I shut the vent off a little
Goal. Oh, there it is. Modernize reimbursement systems to better support aging services, care coordination, and rural provider sustainability while incentivizing quality in-person center outcomes. And then think about updates to current payment models. Maybe that could be implemented. Again, trying to improve upon systems that are already in place. And then if anybody has a magic wand for that rural provider sustainability, let me know. Put it in the Slido.
With a lot less.
Continue to type, but I'm gonna transfer it over to the next one. And the last goal is to build a stable aging and care infrastructure that meets current needs and is prepared for future demographic and economic shifts, supporting both those who deliver services and those who rely on them. And again, this goes back to what we talked about, not only supporting current elders and those that need it, but then also preparing how this is gonna be sustainable going forward.
And it went away? Yeah. Oh, shoot. Okay. Okay. Do you want to edit that one? Or did you- Oh, so if you don't, okay, so I'll be. Again, I didn't get all that. Yeah. You probably had a whole paragraph.
So why am
Yes. Kyla and Heather. You guys. Kyla. I got an idea. So they said something about a tax. Well, we got a kickback on Yellowstone. We could use that every time I end up with a place. Montana can, yeah. Yeah, chicken royalty. Good job.
But.
All right, well, I'm gonna apologize, because I was just told that by me navigating the question, it actually cuts you off from typing, so I apologize, you had a whole paragraph and I moved the question. Sorry about that. When it comes to fiscal, who would like to have a comment first? A goal or strategy? There's some good ones on here. The back table back there, I know I said it, but just for those of you coming in, every time they play an episode of Yellowstone, that Montana gets kickback on it. And use that funding for long-term care issues. Problem solved. Thanks for coming. Literally, mic drop. Again, that's why we have these summits, is because I would never have thought about that, so thank you. Yeah, perfect. I think legislation would really hone in on that as well. Yes. Okay. Another thing, I know that it is a tendency for people to kind of hesitate away from commenting on this, but the marijuana tax, where is that tax going? How can we use those funds? I know that other states are utilizing those funds for a lot of different reasons. So again, we think outside the box here. You know, we can't just make money growing trees, but how else are we going to tap into some of these resources?
What about tax breaks for, you know, big employers, big businesses that would support, you know, the aging population? Or do you-
Anybody else have some ideas? Good, Dave.
I think first you have to come up with realistic reimbursement rates. I was in the guidehouse project when it came to Medicaid, and the cost was figured it was $300 per person per day. So they would give us 250. I spoke on the legislative floor and said, if we're $50 loss each day per person, how long do you expect us all to stay in business before we lost 12? Their answer was, we'll give you 279. I said, still, it's $300. And in my little communities area that I have, it's about a $1 million swing from 279 to 300 per year. The answer to me on the legislative floor was, we'll get it from your cash customers. They get the difference. I'm at 78% Medicaid, so I have 22% others. 22% are not cash payers. There are no payers. I can only get it from. So realistic rates, I think is really what has to be looked at for all of us to stay in business. The CMP funds, that's great for grants. Put it back into the system. They're taking it away from the revenue, put it back on the revenue stream. And that could be done not just in Montana, because there's funds all over the nation, and it should be done by the quality of care that you get to how much you can get back. Could be federally funded, not state funded. I think just realistic reimbursement that has to go with Medicare also, for what they'll pay on PDPM, where if you don't file properly, I can get the same patient as you, and I'll get paid more. How is that fair? Because you don't put the right code in. That's a problem. 4 years ago, I was $513 per day in PDPM. Right now, I'm at $675. I have not changed the thing except for our code. So I just think realistically, this would be.
I think I saw their reimbursement for window time, because we are such a rural facility, excuse me, rural state. Anything else? Tyler, I know you probably have some good ideas back there. Yeah. You want the mic? Yeah. Only one.
Hi, I'm Tyler from Billings. One of the things that's interesting, is we haven't seen a large federal increase in Older Americans Act money in a long time, so a push at the federal level potentially, but also, we saw some flexibility for Meals on Wheels during COVID. That has now gone away, and so it'd be really interesting to see about a change for simple things like that we learned in COVID to shift some of the dynamics. So Meals on Wheels making folks more independent, especially in rural areas, if we could make that flip. Where we had the ability to send more Meals on Wheels or packaged meals home during that time. So right now, there's a lot of restrictions on that funding, having to be for congregate sites versus sites, so.
Did anybody, I may be trying to speak to this, but I don't know a whole lot, or for sure. Did I see that there is some movement towards, the per diem rate, as far as spend down allotment? Are they looking to increase that with the cost of living? Denise, do you know? I thought they were proposed, sorry, your mouth. Did you see, have you seen?
Nursing facility per diem, or I'm
Well,
sorry.
both, I guess both, all, like the spend down allotment, I can't think of what else I thought.
Well, the rates, the Medicaid rates are, state fiscal year, July 1 basis. And the rates that were just implemented are, excuse me, they're still in the administrative rule process, but there's a 3% increase effective July 1. And then your second spend down is really, I would tag. I don't think you're wrong. Okay.
Quick question. Social Security. Now their cost of living is supposed to be going up, right, for this year? Is that 8.7 or something like that? Wasn't it something like that, 8.6 or? It's a high number. Yeah, for the seniors, for the Social Security. Right? No? I read that somewhere, so. I asked.
Yeah.
Is that on a federal fiscal year, October 1?
I don't know, I can't remember. There's so many proposals out there and then so many.
I'm wondering if the areas on aging might.
Oh, the bill failed, that's it, okay.
Yeah.
Anybody have anything? I warned you guys about the aftermath of lunch. I gotta be talkative here. Fiscal, how about, I'm trying to think of some other ones that were suggested. We talk about staffing issues, right? We talk about how that the agency staffing is such a burden on some of these facilities and these agencies. We talked about in other summits that we would implement that into the high schools. So we're now engaging high school individuals to go out as far as like a credit for school or something part of their class schedule is that they actually get to go into CNA classes or they get to start their nursing classes early. So those are ways that we can maybe fiscally look to navigate some of our barriers.
That was a comment. There's a lot of great.
Yeah, there is great comments out there.
There's.
I would love for, yeah, if someone wants to expand on their comments, we would take those.
Oh, where else do we have here?
You know, and I think that we talked about this and we talked about it in a lot of different summits and even the roundtables, we talked, the quality help come from. Well, I know that there is a, I think in Billings, we talked about the fact that people were looking at getting workers from overseas, getting their visas to come be healthcare workers in the States. But navigating that barrier is not only expensive, but also time consuming. So I know that those were things that we were looking at, but I do agree, like where's the quality health or quality care gonna come from? Does anybody have any suggestions on that? This is the tough part of the day, the challenge, because we all have ways to try to navigate it. But again, can we put it into reality here? Let's just see if I can. I'm just trying not to trip on this.
So one of the things I put in there was looking at a long-term care, a public long-term care insurance option. Because we know that most people don't have that because it's really, really expensive. So if there are a way for people to buy into that through payroll taxes or some other way, I think it's Washington State that's doing that, and they're having some success with that. So maybe we could look at that in Montana. That might be something that we could do, that people could help, fund some of their own care. And one other thing, I'll got one. One of the other things that we know as AAAs and the aging network, that we really provide some of the only, or maybe the only subsidized care option for older adults who don't qualify for Medicaid. And that's a very costly thing for us to do. And this last legislative session, we were excited and pleased to get an increase for the first time in our state funding since 2016, but it was really just maintenance. It was not to expand, it wasn't to help more people, it was to keep from cutting service. But that's something that, when we talk about helping people who are in that limited income, middle income, but too much to qualify for Medicaid, but not enough to private pay, we're really where that service sits. So to have the state be thinking about, how to help us do that. And then also to Tyler's point about those flexibilities that we had during COVID, those are really important. We were able to move money around between all of the different titles in the Other Americans Act in the way that we needed it. And those flexibilities have since gone away. And to the extent that we might be able to ask for some waivers at that federal level to let us do some of those things, there may be some opportunity to do that. And especially since we're such a rural and even frontier state, there may be some things that we could ask for. I don't know if we get it, but it can't hurt to ask, to say, hey, we have some really unique needs here, and could we have, some of those flexibilities that would let us, even if it's not more money, to at least let us use the money that we have in a more efficient and effective way. That was two things.
We still are fighting a lot of the carryovers in facilities from COVID, and they're being short-staffed. One of the unique things about small rural areas is a lot of times they will offer training programs in their facilities. So if somebody does want to come in and become a CNA, or anything along those lines, the facility will offer these programs. But since COVID, there just seems to be this lapse of us getting back to taking the money that we spent in like travel agencies and nurses and things like that and putting it back into the community. There's like a 65% wage difference for a facility to pay a traveling nurse compared to somebody in their hometown. And just, I've done this for a long time, various different situations. And to be a staff member of a facility for a long period of time and be a part of your community, take care of your community members, and then have somebody who's a traveler come in and take the job, that you've been doing for years and get paid so much more than what you have is very, very disheartening. Not to mention that when you have these travelers come in, they were trained in different states with different practices of scope, and they were shown how to do the same thing, and they don't have as much sensitivity or the need for quality control in regards to how they're treating our community members, because guess what? In 6 weeks, they're going to move on to something else. And, I understand that COVID is horrible. I work in COVID things, you know what I'm saying? But there's got to be some kind of recovery process in this. We
have to get to the point where we're not working in this crisis mode all the time. And we have to pull these other entities from outside of the state or whatever it is and start sinking the money that we do have right now, that access that we do have right now, and put it back into our communities and put it back into our senior care. We've gotta come off that kind of stuff.
We've got travelers out last August. I interviewed the residents and the staff. Residents said they did not want them on the floors because they killed poor, to say the least, and that they would actually wait for a little longer call if they had to without having the travelers. Staff was the same way for what Richard just made because you have somebody making more money, actually working less. So we had no one applying, no one coming in. So how do you build people? I'm a little luckier than some, but maybe you take a little shirt tail off of this. I have long-term care and assisted living. So what I do is I pay for the class and I pay for the time that they're in the class. As a scholarship program. It costs me about $3,500 to $4,000 per student, but I'm gaining a CNA. A person that's 18, 19, 20, 21, could tell them to take 2 to 3 weeks off of work, not get paid, to take $800 for a class. They can't afford it. They have a cell phone bill too, rent to pay. So I will pay for that. If class, we don't teach them ourselves, we go to college for it. If the class starts next month, we put them in our assisted living facility and we can work on as a CNA and all the same duties as a CNA and train them, getting ready for the class. And still pay them. Because assisted living, you don't have to be a CNA to do the CNA duties, long-term care you do. So I started in assisted living, they go to class, they pay them in the class, they pay for the class. When they come out, they're oriented and they're ready to go for it. It can be up to a 6-week project, but I have a homegrown CNA that's only been taught by us, for us, so they know what our expectations are. We said that last January.
And that's a great process because, as we talk about, if you get an IJ, you're not able to train, but if you do it through the college, that's your way around that. Oh, $12,000 in that's. Okay.
Hi, this is Marcy with Area 2 again. And I just wanted to bring up as we talk about the adaptations and Lisa talked about waivers, Tyler talked about what we could do under COVID and what we can't do now. We do have a CFC self-directed personal assistance services system in our area agency. And as we look at those staffing shortages, it is important to look at those family caregivers, especially spouses. And historically, that was something that we weren't allowed to have. Under the CFC programs, it was viewed that that's kind of a responsibility for a spouse to take care of a spouse. And we need to sit and look at the fact that sometimes spouses have to come out of the workforce in order to take care of that loved one, and they don't have the insurance, or they don't have somebody else that can come in and take care of that loved one. And there's so many different things that go into the aspects of that. And just looking at those systems and services that we do have in place, and how do we tweak those when we look at those staffing shortages or the financial issues involved.
Great point, because I know that, like you said, it wasn't recognized before, but who's gonna take care of the loved one? And then, yeah, insurance on top of it, paying for bills on top of that, so, yeah, it's tough. And then again, we look at the respite for those caregivers. We also have a financial solution. Anybody online? And just rereading through some of these, I mean, you guys have such great ideas. If this is gonna make, again, the strategic plan that we have to come up with, it's gonna make it, there's a great amount of information here, and it's gonna make it, I guess, difficult but easy, because you guys have such great thoughts. Does anybody know of any, I guess, infrastructures or anything in place in other states that they would like to share forward as, something that you find is unique or helpful? Takeaways? Actually, I'm gonna.
Good afternoon, everybody. My name is Janet Brown with Granite Peak Home Health. What we're running into in the rural areas is there's no way to get out there. What if legislators, whatever, decided to buy old hotels? And when the patient discharges from the hospital, they live in a rural area, they have the opportunity to check into that hotel, they can still receive the services, not staffed 24 hours a day like a nursing home or a hospital, but more like home. They can still get a meal there, but then the services that they need will be able to get to them when they can't get to them in the rural areas. I'm from Texas, by the way, so.
Careful when you come talk to me. I think that's meeting the individual where they're at a little bit more. Again, not a permanent, place of residency, but at least to get those services needed after discharge. And that could help nursing homes or discharge or hospitals when they're stuck looking at places to discharge and it's not a safe discharge to home, but they maybe after a couple days could be. Yeah. Anybody else? We'll just sit here and stare at each other until we have ideas. Denise, do you have any questions? You want to maybe probing questions? Yeah. Okay. I'll pass the torch. No one wants it. You don't have to run around the room with it. But, so we do like to offer something for more of a probing question. If you could change, alter, add, do something to our current state of the long-term care in Montana, what would you do? Who wants to go first? Like a magical wand. If you had it, what would you do? I'll let you guys think about it for a little bit. I think if I had an opportunity to change something, just having been in all the round tables across the state, having worked in long-term care, having worked in the clinical setting, I feel like Montana needs to establish some sort of insurance specific to Montana. Because I feel like we're a little bit unique in that aspect. How do you change? And world peace.
I got a question about Medicaid waiver. I know there's a long process with this sometimes. I've worked in assisted living, like I said, 14.5 years, and there's a lot of facilities or people when they try to get on Medicaid waiver, it takes anywhere from, let's see, their average 90 days to 6 months to almost a year to get on it. And so these facilities are kind of biting the bullet on somebody staying there basically for free, because they're for profit. And so why does it take so long? That's my question. What can the state do or whoever to make this process a little bit easier? I know there's like a 45-day or 40-day window in there where they finally get a caseworker to look at that file. But why does it take so long? That's my big question.
Anybody have an answer for that one?
myself, I've had quite a bit of different healthcare issues. And it feels like various issues, whether it's medications or hospitals or doctors or specialists, a lot of it comes down to big insurance and what they will and won't pay and those kinds of things. I don't know how we exactly change that. But what is your Montana insurance thing look like? How's that? Or do you know? Is that?
It's just, strange, but yeah, I mean, I think, well, one would be reimbursement for a window type for sure. Two, I think that, you know, we look at, maybe even mileage reimbursement for the individual. You know, something like that, so they can get to the care, but they wouldn't have to worry about the costs associated with it. That's a good question. I don't know. But that's a, you know, that's just my suggestion for, that'd be good.
Oh, did you just roll your eyes at the microphone?
No,
Tell us who you are.
Yeah.
So, yeah, no, I'm Alexis Marthaler. I'm the Quality Assurance Program Manager with the Big Sky Waiver. And, no, you're right. There are two aspects when we're talking about getting somebody on the waiver, and the big one is getting someone Medicaid eligible. And that does take a while. That's completely out of our control. I wish we had more control over that, but we don't. And I don't know, I know enough to know that I don't know enough about Medicaid eligibility. Once they get that Medicaid eligibility and they get at least to our program, we have a needs-based wait list. So the case managers score somebody and then people with the highest needs kind of rise to the top. So there is wait lists. Sometimes there's a little bit of wait, but I know the biggest wait comes from getting somebody actually Medicaid eligible. That's the biggest hurdle to get over. We also do have certain slots. We have some reserve capacity slots. I think we're maxed out with those right now. For people who are already in an assisted living and have spent all their money, and in order for them not to get kicked out of the assisted living, we have those reserve capacity slots that we can say, okay, we can, once you get Medicaid eligible, we can kind of slide you in. So, I mean, we are addressing it. Is it perfect? No, but the biggest way generally is Medicaid. But we do try to get people on as fast as we can.
Is there a bigger trend for the waitlist that's assisted living and that very large?
Yes, by region, yes, there are some regions. If you look at our numbers, most of the people we're serving right now, most of our money is going to assisted living. That's just how it is. We're trying to put more slots to assisted living, because that's another thing too, which will be like, well, I don't have any assisted living slots. And I'm like, well, okay, but you have 20 basic slots, so let's take some of those basic slots and make them assisted living. It's just trying to work that flexibility. And Big Sky Waiver is going through some big changes right now, so we're working on, we're like, I don't know, kind of construction workers. We're coming in and changing everything and building it up and trying to make it better. So I guess excuse our dust, but we're working on it.
Okay. And a side note too is people transitioning from a nursing home. They go to the night policy nursing program.
Hold on.
Anybody that I am able to sign around to the night policy nursing program director. Anybody that transitions from a nursing facility or actual institutional setting, nursing facility, sometimes a state hospital, regular hospital, there is no wait list. We bypass the wait list for the Big Sky Waiver program.
So if you could change one thing, what would you change? And I think Liz, I think you would wish for hand hygiene, right? That does an excellent job if you guys are on the HAI calls with the wealth of knowledge when it comes to infection prevention. So that's good conference here. I know that Virginia, you're not gonna like this, but Virginia and I had a great conversation earlier in this summit. And I just wanted to give her some time on the mic because she is a wealth of knowledge and she has a lot to share. So I'm going to give this to her. I apologize for calling you. Thank you very much.
Yeah, I began my conversation that, I am now 80 years old, and, I have been in a lot of people who are all in. I think I started coming to, the governor's conference on aging, 30 or 40 years ago. And, I'm really glad to see a few more silver fox people in this room. But, and in those days, never ever would I have imagined that I would still be attending the governor's conference on aging at 80. But here I am, and I came today really not sure of what this was going to be about, because in the old days, this probably was slid under some other topic. But it's kind of like all the same, you know, some changes, but you know, in my role in healthcare, I'm a registered nurse, and I work with, I really feel when I look back at my work history, because I've been privileged, and I do think privileged and trained to be in case management with the mental labor program. For a number of years, I was in Great Falls initially, and I was moved my final time there. I've been director of a hospice program. I have had the privilege to work within the disability realm when I worked at Easter Steel, dealing with the aging developmentally disabled population. And so I look back at those years, I wasn't really quite sure. You know, I really was sure. I want to share it, but I don't want to share it. I'm not doing my horn, but my belief is I am never unique. I believe that there are a number of us that have been given the privilege and education to do what all you are doing. And we're up in years now, and we're still very capable of helping the elderly population. For here, and I know for myself, a big component is volunteerism. And I guess, you know, it just struck me at the beginning of this. I do believe volunteer, we have, let's put it this way, I think this volunteer population that's come along with the baby boomers, they're highly educated, a number of them, compared with our past elderly people have been. And, you know, new inventions came along that baby boomers demanded of us. We've been given much, we have had much better medical care to medical advancements. We're healthier than, you know, my relatives that have come behind me. My husband had Alzheimer's, and I was determined to keep him at home. And so I have that in my background, and I guess basically what I was sharing is I have to believe there's a wealth of resources out there. And I do see this, this is part of the state's responsibility. Because it has to be such a commitment. And I think for me to be really excited and committed about something, I need peers. I need people that are on the same page with me. And I also am a believer in human relations. I love when people here with silver hair said about, you know, the technology. You know, I know enough to maybe get me by a little ways. But Lord, you tell me to go online and find this or that or the other, it's like forget it. I am definitely a people person, and I think most of us are coming to healthcare or our personal services are people. We don't come in because we're going to get excited. But anyway, in some way, looking at what we have, these people are out there, I guarantee you, and they're you know, they've got such a wealth of information. We were given opportunities for wonderful education. You know, even going into, we talk about rural Montana, in the days that I started case management, we weren't in a lot of counties. In my role in Great Falls, you know, we're determined to bring it into Perkins County and Ponderay County, and then when I got to Butte, we were in Powell County, we were in Beaverhead County. And I've always believed that those people had every bit of a right to the service that other counties
counties did have, and they shouldn't have, been neglected just because of where they live. And it was the same way with hospice, when I worked hospice, because we had wonderful volunteer programs, but the ones that were hospice certified, Medicare certified, they got money, and the money was able to put a lot more services into the homes and support those families of people who were, in the last stages of their lives. So I believe in Montana. I believe that there's exciting things that can still happen. But I also believe we have to identify, we're talking about serving the elderly today. Well, we have served the elderly in the past, and we will continue to serve the ones in the future. But it's to me, it's the voice of experience. And I know for a fact, more people that are aging out there are like me, and they don't wanna, what did you just say, echoes coming into the world? I said, oh, people, are you kidding me? I don't want her in my house. I just want a person. I just, it's all these possibilities are there. But I do believe, never forget us old folks in this realm that can still not so much work, but volunteer. But we need to be organized. Or I should say, well, hospice too, but as a case manager through the years, the groups of us case managers around the state, we were so cohesive. We were, if you had a problem, you call elsewhere, I can't tell you how much I gained from that mere thing. Let me put this in the mail, believe it or not, and I'll shoot this off to you, because we shared. We didn't really do a lot of reinventing. At the state level, again, that was marvelous. I don't know, Denise, if you'll remember the names of Jay Consumzo or Cecil Cowie. Those were the gals at the top that were so amazing. All right. Yeah, but anyway, it's possible, I'm here to tell you, and I'm also here to tell you, it's like, having this information yet to share. I want to serve, but where is my niche now? I was been volunteering at one of our senior centers in Billings, but, where else do I go? I kind of just wander in a way, but I'm available. And I just believe I'm not unique. I totally know there's others out there that are in my same shoes. But yeah, so state of Montana, you have a big job. But anyway, that was all I wanted to share. And I really did enjoy listening to all. I mean, just what's the gal from husband with Parkinson's and the farmer and where she's gone. I mean, I'm here because I want to continue to learn. I want to continue to learn and to serve. And it's possible. And I really believe it can go forward. So thank you. And I don't know if I really mean that, but thank you.
Careful what you ask for. Okay.
I just want to pass along another comment from Nina. She's with Fort Harrison. For those rural areas, would it be more helpful to have the healthcare providers have a space to get to their clients safely versus having to travel far or what have you, like an Airbnb for healthcare?
All right, we're going back to, if you could change one thing, what would you change? What about from a provider standpoint? Again, not to call you out, Dave, didn't you say you have a gerontology surgery? Just from a provider, I just interesting.
I'm Tyra, I'm a geriatrician, benefits and senior services today, but then also helping operational and healthy aging. I'm here mostly to learn. I've only been here for 2 months. I think Montana has, I first came here to learn the resources in the community because that's when I want to integrate and I love teaching. And there's some really amazing opportunities, but there's a lot of overlap and then it's really great collaboration. They try. It's not like they're trying to do things silent. So I think that we started with earlier today with trying to put all the information in one central spot, even if it's not for patients as much as it is for us in this room, so that we have a central resource. So we're not duplicating services. I think that'd be a great place to start.
Change the generation gap. One of the things that what we see is that the younger people, don't want to make anybody mad, the younger people do the microwave cooking and the elderly like the homemade cooking. And so it's hard for those younger people to make something from scratch, and that's what the elderly people like, you know, on that part. But, and you know, it used to be grandma stayed with everybody, and so they would know everybody. I mean, you know, the younger people would help take care of grandma. Well, now the siblings all have moved to another state, and grandma's still here in Montana, and there isn't that close-knit format that they used to have.
I put a couple things up there, but I think, just to echo what that gentleman was saying, the Medicaid application process is so cumbersome, and with our case management team at Aging Services, and people are receiving so much mail, it's really confusing to navigate the long-term care Medicaid process. Even when you have help, so make that easier. And the other thing that someone talked about the Medicaid spend down, and this might be a cost up front, but the fact that people receive their pink slip in the mail, and then people have to send in a check, like if there was some sort of electronic payment, that'd be great for providers. It would make it easier for family caregivers. I know when I was working with family caregivers in labor, they're like, I can't just automatically pay this. So it's an additional burden for them. So those are a couple of things. Yeah. All Alzheimer's.
All right.
Just real quick on, people can pay their spend down over the phone. They don't have, like, you can't go online and do it yet, but they do have the ability to call the number on the payslip and pay that payslip over the phone. Just in that way, but we do have a question. So for whoever put the work with big skyway routines, have shared service models, it saves money and addresses workforce shortages. Shared service models exist in Missoula. Can you put that in there and elaborate on that? You know, we're curious as to what that is.
It's me. Oh, you're back over here. That's right. And have that brownie after.
Me again. And I'm Autumn. I think I introduced myself earlier. Shared delivery was a combination of community first choice services and Medicaid waiver services. So for people living in, and I apologize, I tried to add as much information as I could, but those are apartment complexes. So they're not assisted living, but it's a place where the residents can, who have, who are elderly or disabled in those specific apartment complexes, it's people with disabilities. Many of them qualify for CFC, and those apartment complexes have almost 24-hour care with those residents sharing their CFC hours and waiver supplementing the rest of the hours.
When I worked waiver, we had a person in there on a ventilator, which you can't support in the state of Montana. Maybe you can now. I'm realizing my knowledge is a little dated, but, yeah, so it's pretty innovative. I know, we were working on it with another CFC provider before I left waiver, but, really a more creative way to deliver services to people's homes where they don't have to move and they can share those hours that they have.
It helps support the agency that's providing the care, because not all agencies would be able to provide round-the-clock caregivers. But with everyone kind of pooling, and honestly, it was not always something that the state has supported, but just everyone kind of pooling their cost plans together and their services together, the support is there, and it actually in real life works lovely.
She knows more about this than I do, but I'm starting the conversation. How about putting the college kids and the elderly together? And so the college kids can live like in the nursing home and get tuition, so they don't have to pay for a place to live, but yet they could work it off at the nursing home. Well, no, but you were saying that there's somebody that does that. It's, anyway, just that way the college kids won't have so much to borrow to get to college, but yet the senior care will get assistance too.
Okay, over here first, and then we'll go.
If we had a magic wand, obviously, we would have more facilities. I agree. But to kind of tweak that a little bit, we, as an ombudsman with, residents coming into facilities now, we are dealing with a lot more of mental health issues that are kind of coming to the surface. With this age population and this demographic, we didn't talk about mental illness. It was, if you had somebody at home that was mentally ill, it was kept in the family. We don't air out our dirty laundry. It was left underneath the rug. And, that's how it was. And so a lot of our facilities, current facilities, are not prepared for this. And so we get this resident in, and anybody that has these issues, when you disrupt their schedules and how they live and everything like that in their environment, it can really just rock the boat. And as an ombudsman, we'll say, I'm sorry, but behavior is not a diagnosis. So I guess if I had a magic wand, I would have all of the facilities that we would need and then specialty facilities that would handle certain programs. But I think right now, an easily reachable goal, for our programs is to get some extra training into these facilities so the staff knows how to handle these particular issues, behaviors, and things like that. Because we run into an issue where it's, we're gonna fill this bed, we're gonna get this resident in. We didn't know that they were mentally ill, or we knew that they had some mental issues, but we're gonna come in and we're gonna take off all of the medications and we're gonna kind of restart, and then the issues build. And then they become disagreeable with the staff and become a very tense situation and make it very, very complicated for the facility. So if we could get some extra training into these facilities for the mental health issues, I think that would make an amazing difference.
Typically, Elon Press. Make my own beautiful bill. I would take control of all the different pockets of money that they're there, that we'd be able to gather money from. We don't know where to go. And so we're talking about trying to go someplace to have people be able to go someplace to be able to find out where they're supposed to go. Why don't we just pool all the funds, make one-stop shopping. So that one place you call, and if you want to talk about waiver, that's the same number you talked about for long-term care Medicaid. It's the same number. Are all the funds being used? Because people don't know where they're at. So just have one stop for everything, all the money goes to one pot, and that's where it works for.
Anybody else want to share their thoughts? Others? Okay.
Heather O'Hara with the Montana Hospital Association. Thanks for the great conversation today. The two things I wish for is one, is adequate reimbursement. I think if we were all reimbursed according to the services that we provide, that would probably solve a lot of our problems. And of course, workforce. I could pull nurses out of places, that would be great. So, those would be the two that I'd like. Okay, anyone can do that too.
Thank you. Anybody else over here? So April brought up a great point. You know, we focus in on what's not working. We want to know what is working. Does anybody have something that is just great that they want to share forward? That's like, this is a great program. This is a great process. Anybody have something that they would like to share?
I was actually thinking about the lovely lady from Billings who was talking about sharing her time, and we have this incredible group of volunteers who are, a lot of them aging themselves, and they give so much of themselves and their time. We have a program, it's a caring companion program, and these volunteers show up and they go and they take their clients out to lunch and they play games with them and they take them to appointments and they drive them around and they take them to Walmart and whatever it is, and it provides companionship and friendship. And it's all done with what people are offering from their hearts. And that's a really incredible process to get to watch and to be able to stand beside.
Anybody else have something that's working and fantastic?
The girl that's probably not supposed to talk. Money follows the person. And that's what works. In Montana, it's been rebooted and it has, well, real quick, when I say money follows a person, who knows, who heard it today. But the institutionalization, so when somebody's long-term in a hospital and sometimes they don't know their options, right? And most in money follows a person situation transition to an assisted living facility, some transition back home or to an apartment. And so it's been brought up a lot today about the availability of supports and what those supports bring, and the choice and the knowledge and the capacity of what that comes with it. Money follows a person is something that I won't spend a lot of minutes on, but look it up. Be aware when you're aware of somebody that's in an institution and has the ability to live in a community of their choice. It is a viable option in Montana. And not because it does this, but it does save money in the state. There's a return. Because it is a lower cost of care. There's a reimbursement for a higher cost of care that might not be needed or might not be needed anymore. In this total dead space, I would love any questions or comments or thoughts on hospice. What works, who's here that works with hospice, just anything that comes to mind.
Any takers on hospice? Oh, okay. I thought since you had a question, you were gonna run it.
I would love to
And-
move around.
I'm Joe Gilboy, the director of the Area 587 Aging Butte. I don't have anything on hospice, but we're talking about things that are working. The Aging Network does have an 800 number. And if you call that number, it'll ring in the local area agency. And so we all have staff that's trained to guide you to whatever services, we always say, we might not know the answer, but we'll find it for you. Granted, we all have our staffing issues. We all struggle maintaining staff and doing things, but that is what our ultimate goal is. So we do try to provide that service and try to be the main contact. The other thing is you talked about a wishful thing or have a magic one. I think a single funding source. We fought years and years ago for, the idea was a fee for every soda pop sold. There would be a nickel and it would go to aging services. Sadly, when I got to the legislature, they turned it into a tax. And as soon as it was a tax, they wouldn't vote for it. But even ARP was helping us with it. They did surveys. People were more than willing to pay an extra $5 to go to aging services. That would have gotten us off the coffers. We wouldn't have had to fight for the general fund. Something like that. If we could work towards those things, I think it'd be a great way to help, funding, get some sort of single way. I've seen a lot of those things up there about, taxing alcohol, taxing marijuana, those different things. But I think if we could do something that went directly towards these types of services, it would really help us make them robust.
Anyone else have anything to share?
There were some positives in the 2025 legislative session. So there's 4 new compacts in the state of Montana. So licensees are able to use in the state a lot easier with these compacts. You register dietitians, respiratory therapists, your PAs, as well as some psychology professionals are able to get into the state a lot easier to do the compacts. So that's a positive thing. Another one is the apprenticeship. So they are building up more apprenticeships in the state of Montana. So individuals who are interested in going into healthcare can start with those apprenticeships and get paid and be able to stay in those apprenticeships. Another unique bill came actually from out of Great Falls, and young high school students that want to work in long-term care, assisted living, can actually get high school credit towards graduation if they want to become a CNA. And so there are a lot of positive things happening. I don't want to be always negative. So, and then the Department of Labor and Industry, along with those compacts, has also opened up a lot of things that just makes licensing a lot easier, because the state of Montana sometimes can be hard to get a license for those social workers or for whoever needs to come into the state. So lots of good things that did happen in the legislature this year. So I want to make note of that.
Marcy, is there anything online that anybody wants to add?
Nope, not in chat.
All right. Oh, perfect.
So I've been thinking about the one thing. It's hard to do one thing. Yeah, so I think a lot of times we hear about how, well, families should be taking care of their older adult loved one. And I think if I could change one thing, I would change people's understanding of that families are taking care of their loved ones. They're working really hard to do that, and they need a lot of help, and they need a lot of support to do it, to keep doing what they're doing. And along with that, I think the idea that when we support older adults, we are supporting families. We're not just supporting that person, we're supporting everyone around them. Because caregiving, we love the people in our families, but it can also be really hard. And it can be impossible sometimes to do the things that they need. And so that isn't just support for this segment of our population, it's actually support for everybody. And that might change some of the narrative and some of the understanding of decision makers around what it means to make the choice to put funding and support into long-term care. It's really about supporting Montanan families and Montanans of all ages, not just the older adults themselves. That's my one thing.
All right. So we, I guess we will conclude with the, portion of, or the, I guess, official portion of this summit. I just want to again, thank you all for showing up today. You being here is helping us move forward to making Montana's long-term care better. Not only for those that are currently needing care, but those to come. So again, thank you guys so much. The Slido will still be active for a few days, so as you're driving home or throughout the governor's conference, something comes to mind, please hop on and put your information in there, or email me or Denise or someone. We want to hear from you. We're at a pivotal point here. We're really fortunate that, you know, Denise and her team are excited to make a change. So again, please feel free to stay, connect, network, bend Denise's ears or April's ear over there. So again, we just want to extend a big, big thank you to you guys for being such great attendees and putting up with me as a presenter. And there should be some snacks out there again, so grab a brownie or whatever they have out there for you. All right, thanks guys.
Oh,